Got 1 minute till I go live, but clearly a fun night was had in Berlin last night. I heard it was the Gnosis party, so those of you who have made it today, well done. We are going to open today's talks. We've got half a day of talks, so we'll have a couple, then we'll have a coffee break. There are delicious snacks, pastries, coffee from the cafe next door, West Berlin, that you are more than welcome to help yourself to. For those of you who weren't here yesterday, we've got a bathroom over here, a Wi-Fi code's on the back of the door, and inside that room, that kitchen, there's a fridge full of cool drinks. So yeah, today we're going to start off with my colleague Ben is going to join us and give a talk. He is going to be talking about his coin-to-company model, which is solving the age-old problems of tokens and equity, and how one might find a creative solution to build a legally compliant solution. So thank you so much. Thank you for coming. And yeah, you'll see more of me. Ben, welcome to the stage. There we are.
Testing. Okay, great. Hello, everybody. Thank you for coming. After a good evening last night, today's discussion is really legal and compliance focused, but not just what we shouldn't do, but what we are doing and plan to do over the next year. So what we're going to cover today, we're going to go through a little bit of where we've been historically with Molecule as it stands. What's changed a little bit, particularly in the United States over the last year. I think everybody's aware on a basic level of what's happened, but going to get to a little more detail on how that applies to what we're doing within the DeSci movement. I'm going to go through something that we've been developing called the coin-to-company model, what that is and what that means for the ecosystem, how it works, particularly with a token locking and equity system, what's different about it, and then what are the benefits of it, what it ultimately produces. So Molecule historically has been set up in Switzerland, organizing DAOs through Swiss vereins or associations, using the Swiss DLT Act, a combination of laws in Switzerland that allow Molecule to legally launch tokens. As you know, Europe and Switzerland were well ahead of the United States when it comes to passing crypto laws and making this available, and Molecule took advantage of it. It created, obviously, the IP NFTs, one of the first primitives that everybody here is aware of on ERC 721 tokens, and what we call IPTs, which under Swiss law are technically governance tokens. And governance tokens means that they can the project provides the ability for people to give input into the direction of the research, and they also have the token as an asset. However, the tokens are not securities. And what does it mean to not be a security? It means that they don't have an inherent legally enforceable economic right in the proceeds of the business. And that's really the critical challenge within crypto historically. It's what people have often tried to overcome in structuring crypto projects and initiatives. However, as everyone knows, with the change in administration in the United States, it changed the U.S.'s posture toward the crypto industry. In fact, the current administration said that they want the United States to be the crypto capital of the world. And so we went from a posture of the United States government pretty much suing everybody and anybody they could to saying, please come in and build your crypto business here. And with that, Molecule looked at that and said, the United States is one of the largest opportunities for biotech in the world. And so Molecule, of course, looked to take advantage of that. And over the last year, we've been not only looking to enter the United States with the current setup that we have in Switzerland, but seeing how can we go beyond? And how can we create biotech projects that are both based on the blockchain, but also provide people with compliant ways to get the proceeds of the work being done. And so this year, we actually met with the US SEC and told them what we're doing and discussed our plans for them, had an open dialogue. It's with the entire crypto task force, including Hester Pierce, as many of you may know, the leader of the task force, who's a personal hero of mine, by the way. And it was a great conversation. And I think that they're very supportive of what we're doing here. The SEC itself released its own taxonomy for tokens, and we have analyzed what we're doing within that taxonomy and feel quite comfortable how we fit within that as a digital commodity or a digital tool with the IPTs that are being released in Switzerland if they are purchased by U.S. people. And then, as people might be aware, that there's new legislation in the U.S. being considered called the Clarity Act that had a major movement earlier this year when it was passed out of Senate Banking Committee and is being considered by the full Senate here, either in July or August, still trying to figure out the final date for the vote. But there's a very pitched battle at this moment between traditional banking companies in the United States and crypto companies as to the details of the Clarity Act, but it's moving its way forward. So that's where we things stand and how things have been progressing in the United States. What we've been working on, though, over the past year is an entirely new model that, quite frankly, has never been done before. And it's really an attempt to take the best parts of what Molecule has done in the past with DAOs and associations and community groups and integrate them with traditional venture-backed startups. Because they both have their own virtues. People recognize the power of the community. We're all sitting here in this room, for example, because of that. However, there's a lot of virtues to traditional venture-backed equity structures because it allows you to interface with non-crypto institutions, traditional venture capitalists, who expect certain legal structures and certain rights in order to invest their money. And we all know that this industry takes a lot of capital. Quite frankly, far beyond what we can raise in just tokens. And so we need to find a way forward where we can take the best of both and put them together. Quite intentionally, I've tried not to innovate in many respects with this model and reduce the surface area of what needs to be thought through in order for it to be effective. And so what created is it's a two-entity structure. The way crypto is normally set up, at least in the United States, is that you have a Delaware, what they call a DevCo or LabsCo, and then the tokens or the blockchain is held in a Cayman Foundation. And the two are, for legal purposes, treated as entirely separate. And that actually has worked, even during the Gensler era, pretty well. However, for those who are familiar with certain controversies in the crypto community, like with Aave, it creates a lot of tension between the token holders and the shareholders of the DevCo as to where value is accruing, how value might be going back to token holders, if all. And it's one of the biggest issues to overcome to move these businesses forward. And so we have a similar setup, again, taking the best of both. However, asking how can we integrate DAOs with DevCos? Is there something that works that does not turn the tokens into securities? Because if the tokens were considered securities, I think most are probably familiar with some of the issues, but some of the biggest problems with that is it brings in certain requirements as to who can purchase them, the registration reporting with the government, and a lot of liability issues in regards to that. And that's why people try to avoid that status and work so hard to do that. And in this model, we've worked very hard to keep the tokens as non-securities, as pure digital commodities that can trade freely, just like they currently are. However, what we have work to do is create a way for those token holders to become shareholders, which becomes an enormous unlock for letting them get value in the project itself. So to go from a token holder to shareholder, what is that process at a high level? We launch a token just like we do today. Nothing changes in that respect at all. It can be done from Switzerland in the normal Verein structure that we do today. It can be done from the US. It can be done from the Cayman Islands. The tokens are digital commodities like wheat or cattle. They can be traded anywhere. They're just a product, basically. However, the company, DevCo, which is a Delaware company because, again, it's the default for investment purposes and is very non-controversial, makes available to token holders a program, an equity program, where token holders can come and lock their tokens to the company, stake it. And the staking process is very similar to how it works currently, for example, with Bio, where you vote escrow your tokens. It's a very similar technological mechanism. And so when you lock your tokens to the company and vote escrow them, there's an equity program. And then the equity program follows a compliant pathway in the United States, well-established, non-controversial. If you are an investor in a company, that's what we call Regulation D in the United States, or if you're a worker, it's called Rule 701. The Reg D pathway is well known. That's how traditional investors invest in companies, and we follow all the same compliance processes that you would do for that pathway. Rule 701 is how any employee of a startup gets equity in unregistered restricted stock. So, Molecule, for example, has an equity program. I mean, it's a Swiss company, so it doesn't follow Rule 701, but if it's a US company, it's the same thing. And these programs are similar around the world. What's a little bit different here is we want to make it available to the community. One of the best parts about crypto, it's egalitarian in nature. It allows really anybody to participate, and we really wanted to keep that aspect of this program. And so what we are doing, which is a little different, is we are making equity available to community token holders through Rule 701 as contractors. They participate in the projects. They, as I say, yap on social media. They give input into projects. And so for all the stuff that they're currently doing, we'll allow them to sign an agreement with the DevCo or the LabsCo and get stock. What's really important here, though, is to understand that the tokens are not equity and the equity are not tokens. What is innovative here, which sounds surprisingly simple, but it has not yet been done, is that the equity lays on top of the tokens, but the two are not the same thing. The tokens eventually become identity tokens or instruction tokens that tell the company what to do. So if someone had tokens, locked them, became a shareholder, they would use the tokens to identify themselves per share to the company, but also instruct the company what to do with their equity. So if a resolution came up from the company and they wanted shareholder votes, the company requires that people use their tokens in order to vote. If the company were to be purchased and distributions to be made, distributions again would go through the blockchain. And what this does is it sets up the company to be a crypto-based company, but have all the benefits of operating like a venture-backed business that everybody knows. And so it becomes a hybrid two-asset model where you have both the tokens functioning as a digital commodity, but you also have the equity as well, working together in harmony in a way. And this works under current US law. Quite frankly, you don't need any change to implement this. It uses existing pathways. It also works under Clarity. So if Clarity were passed, we've done analysis as to how this would fit underneath that. The tokens would be considered what are called ancillary assets under that legislation. A little bit of an awkward term, but that's what the statute uses, and that's what you'll start hearing people say if it does pass. And if they're ancillary assets, they would be sold under an investment contract, but the tokens would be treated as digital commodities all the same after that point. And so it actually complements Clarity in that respect. Because what Clarity does do, it creates what's called Reg Crypto. It creates a statute that allows crypto fundraising. But what it doesn't do, it doesn't solve the problem that still exists, which is how do token holders get value in the project? It actually doesn't solve that question at all. And so this process here is really trying to change that. Because in crypto, you don't necessarily need an answer for that if it's a novel L1 blockchain, where people are getting emissions from the blockchain, staking with the blockchain. Where it is a problem is if you're launching a crypto token and actively developed IP, much like we have in our community, That's where securities laws come in, the Howey test, as you probably heard. So the final result, though, is trying to put the companies into a posture to benefit from the increasing tokenization of assets. And so once they are operating a blockchain, use the tokens to administer their equity, the company can also, of course, leverage everything that Molecule's built to date. So the tokenization of IP and NFTs, tokenizing royalties from signed royalty agreements and be able to distribute those on-chain, tokenization of contingent value rights in IP, and then tokenization of the securities themselves. And we have not, by design, tokenized the securities themselves in this right now, but it's certainly in our mind to do so in the future. There's some tweaks that need to occur still in US law to make that work that are currently in progress in the United States. And when that happens, we expect to eventually tokenize the securities themselves in the project. I think one final detail is something else we've really worked hard to build into this design is the ability to interface with traditional universities, institutions, VCs that have nothing to do with crypto. In fact, might not even want to touch it or deal with it. Because I think for us to succeed, we need to interface with the larger world, bring the benefits of the blockchain to them, but not force them to use it if they don't want to. And so if you using this model and want to partner, for example, with an investor that doesn't deal with crypto, they can just buy equity in the company. They're required to have the tokens to exercise, but the company can do all that on their behalf. They don't have to touch it at all. So for example, if they wanted to vote just like a normal startup company that isn't crypto, they would tell the company how to vote, and the company would simply exercise that vote on-chain for them under what's called a proxy agreement. And again, if they want distributions, the company can convert the on-chain distribution to fiat and simply send them to fiat. And so this allows the company to integrate with both the crypto ecosystem and the non-crypto ecosystem at the same time, which is something we really work to try and build into it. And really just trying to close the loop. Launch the way we do today, but provide a pathway toward building real value in companies and distributing that value out to the people who have supported the company all along. And so just going over the overall compliance architecture in this, the different aspects of it, you have the initial project tokens. These are essentially the IPTs, but we're just calling them project tokens now in this US model, which are the digital tools or ancillary assets under Clarity. You have your locked receipt tokens. Once you stake your project tokens, you'll get a locked receipt token. That's what you use to exercise or instruct your equity. You have your investor equity itself sitting on top of the tokens, most likely under Reg D, but there's other pathways to do so. Contributor equity, so that's under Rule 701, where you're giving your work or labor in exchange for equity. And then Clarity Act tokens, which again are the project tokens, but would be structured under the Clarity Act. And those are the legal primitives within the structure in its design. So, really the vision realized here is creating a global community layer, allowing people to profit in IP success and having it be defensible, and allowing you to go to traditional companies proudly and say, this is our structure and this is how it works. And everybody having confidence in it. And so that's a C2C model. I think we might have a little bit of time left.
Yeah. Moment for questions.
Yeah, open for questions if everybody has any.
Starting with the legal, bright and early. Cool.
Just in terms of timelines, what are we looking at for the different stages? And yeah.
I mean, we're bringing projects onto it now. So for example, Pept AI currently. We have the technology built out within Molecule itself. A lot of it is just moving it forward. The legal structure's in place, the documents are in place. And so we're currently rolling it out with that project and others. So I'd say now, as far as timeline goes. Yeah.
when it comes to the specific like laws that need to be passed, is the Clarity Act a major part of this, or are there other things that concretely need to fall in place? And
Sure.
is the current political landscape favorable to these changes?
Yeah, so it actually isn't dependent upon, it's not dependent upon the Clarity Act. It's designed to work with current laws as they currently exist. If the Clarity Act is passed, it also works under the Clarity Act as well. And so, going back through, what I was just discussing, if the Clarity Act did pass, they would be considered ancillary assets in the United States, but it would still function under that legislation and complement it.
Cool. We have time for one more question.
Thank you for your talk. You talked about U.S. situation. Could you also comment on the European situation or compare?
Sure. I mean, so currently the plan is to still launch. Nothing changes, quite frankly, in regards to launching governance tokens through BioXIZ. Those can participate in this model. All those tokens can come in and be locked, for example, to the U.S. company and get U.S. equity. Whether, I presume your question is, would we set up European companies and have them lock and stake? We have not done the legal analysis for European companies to do this in Europe, but Europeans can obviously get equity in U.S. companies. So Europeans can participate in this. It would just be a U.S. company. Whether we ever do the probably massive work to figure out whether this works in Europe, I don't know, not in the short term. We're just trying to get this to work in the United States. But given that, it's just such a massive place for capital raising, I'm not sure if we ever will. I mean, maybe, if there's a compelling reason to do so, we will, but not in the short term.
Amazing. Thank you so much, Ben.
Okay, sure. Cool. And everybody, I'm doing a workshop too, if people want to come and just ask questions and talk about them.
Yes, so actually that does bring me to a very good point to let you know that there are workshops happening upstairs. For those of you who weren't here yesterday, you go up there, up 2 flights of stairs, and there's a very cute little workshop room, and we'll have workshops throughout the day. And Ben is hosting the last workshop of the day at about 12-ish. So you can go and chat to him and learn more about the model. We've been working quite closely on it and sort of figuring it out. Well, I mean, I'm no lawyer myself, but I've been doing some of the comms. And I think it's a pretty interesting solution to a problem that is not just native to DeSci, but crypto as a whole. So I'm very excited to see projects starting to use it this year. Okay, we are changing gears a little bit, and we are moving into longevity and the longevity space. On the stage, I'll have Alex Milosky join us, and he'll tell you a little about BetaDAO and what they do.
Awesome. Hello, everyone. Thank you, everyone, for coming. It's good to have you guys here. Many different faces. This is my 5th DeSci Berlin conference, so it's good to see new faces around every time. So welcome, everyone, if that's your first time. I'm here representing BetaDAO. So quick introduction for those of you who might not know what BetaDAO is. It's a decentralized fund and collective focused specifically on longevity research. We've been around since 2021. BetaDAO launched fully on chain, raised north of $4 million, and have deployed that capital across many different longevity projects in startups. So I'm going to talk a little bit more about what we're who we are at the end of this talk, but the focus for us here today is actually to announce our new consumer product that we spent quite a lot of time working on this year, which we're calling the Vita app. So before I go into the details here, quick show of hands. How many of you guys like use some sort of wearables to track your sleep, to track your health? Okay. And how many of you guys have actually crossed that information with your blood work, for instance, or with any other health data that you guys have? Have you guys like ever used AI to do this, for instance? Okay, a few of them. Okay, cool. So this is, well, the gap, you guys could see the gap between the first question and the second question. So this is exactly the reason why we built the app. So the idea is you basically have all of your health data connected in a single place. And the Vita app acts as your private longevity co-pilot, digesting all of that information in a fully private manner. That last part is really, really important because I think health data is, one of the most important data that, we have. So we really, really focus on building something that is fully private end-to-end. So we cannot see your data. We built this because we wanted it for ourselves. We are the main users of this. We don't want to share our data with anyone as well. So it's fully private end-to-end. So these three things have never been connected before, or at least it's not very easy to do so. Your sleep data from your gadgets, your blood work from the labs when you go to the doctor or whatever, your training activity from your gadgets as well. If you do decide to connect them in one single place, you're probably being the product. They're probably using your data to train their models. You're exposed somehow. So you basically had to pick one. So we did build this app to make them all talk to each other in a way that was not possible before. And again, it does all of this fully privately. And for the intelligence behind the app, we built our own AI agent. So this started with the launch of Albright. Some of you guys have heard of it. We launched a longevity-focused AI agent inspired by Albert de Grey and his research. So the agent was trained on, private labs data from his own foundation, plus all the literature, the longevity literature that we see out there. So we train our own research-focused agents, and now we are baking that into the app. So that is the main brain, the main engine behind the application, and it's basically what we use to digest and make sense of all of our health data. Cool, so I want to spend most of my time here actually showing you the app and inviting you to sign up for it. So I have a presentation for you guys here and a little demo. So here's the homepage. It basically shows you, how you're doing overall. So your main metric here, your main KPI is your biological age. So this is calculated based on your blood reports. It takes into account your biomarkers. 9 of them, we're using the PhenoAge algorithm, which is a very, research-backed one. So it basically calculates your bio-age, it calculates your delta versus your chronological age, and then some more data around how you're doing today. So here's your sleep score and how does it compare to the last 30 days, your RENA score. This is coming from Whoop and Aura in my case. And it also shows a little bit of your summary around your biomarkers. And every day you're gonna log in here and you're gonna have a little daily insight created by our AI. That is basically trying to make sense of where you're at and also take into account your goals that you set during the onboarding process. And it basically to help you reach your goals based on how you're doing today. So let's drill into some of these. So your sleep score, you can basically see your entire sleep architecture. It shows your average deep sleep, REM sleep, light sleep over time. It's a very long time series if you're using the gadget for a very long time. Also shows how your recovery is doing with your heart rate variability and your resting heart rate over time as well. So, these two are famously uncorrelated to each other. So that's why the chart looks like this. Also a very long-term time series, which is, pretty valuable. And you can with the agent, with the AI that we have built in, you can reason over very long periods of time. So you can basically ask, how does my HRV from last year compares to the HRV this year, and given everything that I'm doing, like why might that be the case, right? So you can reason over all of your data. This one shows your blood oxygen level over time as well. This one is one of my favorites, particularly. It basically shows your training activity over time. I have a little calendar view, and the breakdown of what you're doing. It's really, really good to help you keep track of how your week is going, how your month is going, and overall, like if you have like long-term data, it's kind of like fulfilling to see how many active days you've had, the duration of your exercises, calories you burn, and so on. This one coming from Magic Gadget. I don't know if you guys use it. It's called Withings. It basically shows your body composition over time, your body fat, muscle mass. And we also have a segmental analysis where it shows those two metrics across your body parts: trunk, right arm, left arm, and so on. And also over time, right? So you can play around here. You can see how it's going. And here's also like a long-term trend of these metrics. Cool. This one is also very important. So this tab shows your biomarkers. You can basically upload a new panel. So say that you just got your new results from the lab. You can click upload. AI will parse everything, and it's going to basically fulfill this screen. So it all works in like 10 seconds. It's pretty good. So it basically shows how well you're doing. And these ranges are ranges that are focused on longevity, right? So we're not trying to be normal. Like, I think this is for like people that are into optimization. So it shows, given your numbers, how close to the optimal range are you, and which ones need attention. So in my case, my last panel had tracked 47 biomarkers, and this is how I'm doing across them, right? And you can see the ranges here. Well, you can also, if you have a problem or like a specific condition, maybe you have like chronic, like high cholesterol, you can also track a specific one. So here you can see like your long-term trend as well. In my case, I have blood reports coming back from 2018 here. So it's a pretty long-term trend. This is also very good for, you to track if there's anything wrong with your body over the long term. Like some of these things develop slowly over time. And, when you catch it, it's already too late. So the idea here is that you can, catch these things early on as well. Cool. Here is the main page where you can interface with the AI. So basically, you can ask any questions here. It has a pretty analytical framing. So, it's always trying to analyze your data and give you some insights. So in this case here, I'm just following up on the daily insight that I showed you guys in the overview page. Just following up and ask, why did I score it this way today? Then it basically gives me a breakdown of what my primary drivers were, and where's the mechanism, and again, like action-oriented, what should be the next step. Cool. Here is where you can see all of your data that you uploaded onto the platform. As I said, it's fully encrypted. So you do have to set up your encryption key before you even sign up, or like during the sign-up process. And here is basically where you can aggregate everything. For me personally, this on its own is already valuable, like having a single place where I can upload all of my blood work in a private manner. Because like realistically, who remembers where their blood work from 10 years ago is stored, right? So I think this on its own is already very valuable. And you can basically delete all their data. We're not going to keep track of anything. We're putting like really users in the center. You can export everything in a JSON file. If you want to use, I don't know, like another tool to analyze it. And then the other two things I want to show you guys is, let's see, so staking. This is where the crypto component comes in a little bit. So given we're not running on an ad model or anything, users are not the products. This is the product that we're selling to users. So this app works on a subscription basis. There's a free tier where you can test it out and so on. But if you do decide to go for a plus or a pro tier, you have to pay like a certain monthly fee. And if you are a Vita token holder, you can actually get a discount. So There is like a discount simulator that we baked into the app here that basically simulates your discount based on the amount of Vita that you have and the time that you are willing to stake it for. So you can stake it directly in the platform. You can add your wallet, stake your Vita, and just keep it staked. It works on a 2-week rolling period. So every period gives you a certain discount, and then you accumulate that discount over time. So the longer you stake and the more you stake, the more discount, the bigger your discount. So yeah, this is a little perk for our community and for our initial believers. Cool, and the last feature I want to show you guys is this. This is basically what we're calling a research radar. It helps you keep track of longevity research given some of your main interests, right? So we built this with people that have chronic conditions in mind. So if you do have a chronic condition and you are, say, like actively trying to keep track of the latest research to try to find a solution for a condition, you can use this tool. So in my case, I do suffer with cartilage lesion in my knee, so I have this term here, and this helps me keep track of the latest research around this, so I can maybe act on it in the future. There's a lot happening already that I'm aware of, but it's hard for me to keep track of it. So this is like my one place. I'm gonna be receiving like weekly or monthly emails with like the latest research so I can digest, and then I can come back to the app, ask more questions, and maybe act on it at some point in the future. So yeah, this is what I wanted to show you guys. Perhaps one last thing. This page, this is my protocol. This basically is our N of 1 experiment. So we built this with biohackers in mind. We know that people like to experiment with a lot of stuff, a lot of compounds, a lot of protocols, training protocols, maybe like some longevity pills that they're trying, peptides, wherever it might be. The idea is you can log everything here, and you can see the impact that it is having on certain biomarkers that you define. So in my case here, for instance, I'm tracking like total lipids, triglycerides, all of that. It's basically gonna take into account the starting period and the end period of your protocol. And if you do have blood work uploaded in between those ranges, it's gonna basically try to see what impact your protocol had on those specific biomarkers. Yeah, and then like in the overview page, you can basically, it helps you keep track of your protocol. So this is, what I have in there. So whenever I'm done with, taking my magnesium, I just come here and check it out. So I know it's done. So it also helps you keep track of things. Cool. That's what I wanted to show. Right. So as I said before, this is all fully encrypted, fully private. Not even us can see anything in the database. All you see is ciphertext. Even if our main database has a leakage, nothing is lost, which is great. But it also means that you guys hold the keys, right? So just like crypto, your keys are tokens. This is your keys or data. So save it in a safe place. But you can also trust the browser. Like if you're using this from your own computer, as I am, so you don't have to be inputting your decryption key every time. You can basically trust the browser, and it's going to live there. But again, if you lose your computer, then it may be compromised. Cool. So let me just get back to where I said at the beginning and talk a little bit about VitaDAO and how does that fit into our broader vision and our broader mission. So as I said, we are a collective that funds longevity science. We've been doing this for over 5 years. We funded over 5 million, almost 5 million into longevity research, more than 30 projects, and we are fully member owned. So token holders are ultimately the owners of the organization. And we have our own governance process where if you are a token holder, you can basically define where the organization is going, where the capital is deployed and all that. And the way we see Vita app is basically how the science we fund and the science we develop reaches your body. So, ideally we're gonna come at a place where some of our projects are actually creating consumer products that can be used in the users. Right, I think some of our projects are already getting there. We are close to getting to clinical trials in one of them. And there is another one that might launch a skincare product soon. So all of these things are ultimately going to be available in the app as well. So you're going to see a lot of the output of the research that we fund in advance in there as well. And how does that how does that fit into our main vision, and how does the flywheel effect work for us here? Every member that signs up in the app actually makes the science compound faster. So we started funding a lot of science, great. We have a lot of scientific data, great. We are using that to train our AI and make the AI smarter, which basically means that our app is gonna function a lot better. It's gonna give you some better insights. All the insights that we give comes with citations, or not, I shouldn't say all, but like a lot of them comes with citations, especially when needed and when requested. So, we have an agent that really understands longevity science. So the better the experience with the agent is, the more users we have, the more funding we have to fund more science. So this is how the flywheel effect works that we're envisioning. So, every sign up basically spins this faster for everyone. So here's a QR code if you guys want to try it. You can start it for free. If you guys have a gadget, just please connect one device, sync it up, see how it works. Your first insight should arrive in about a minute after your historical data syncs. And for the first 50 members that sign up, we might have some surprises for you in the future. So please scan the QR code, and I'll be around if you guys have any feedbacks. I'm very keen to hear what you guys think. Thank you so much.
Thank you so much, Alex. Great talk.
Thank you.
Cool. We don't have time for questions. We're already 20 minutes behind. Forgive me. Next up, we have a very exciting speaker, Michael Torres. Michael is currently doing his victory lap, I think, around the globe, having just sold his company to Eli Lilly for, I think, $300 million. Very sort of successful drug acquisition. But he is also a DeSci Maxi and has been helping run a DeSci project, or managing a DeSci project for, I think, almost 2 years now. And now that he's managed to just make a bit of pocket cash, he's going full in on DeSci. So yes, thank you for joining us, Michael.
Thank you. Awesome.
Wait, give me a second.
Very nice. And I think if I click, that's already on. Oh, perfect. Cool. Well, let me go back first. Hey, everybody. I'm Michael, like Ella said. So good to see everybody. So yeah, really excited to kind of share, what we're doing at Artan Bio, and then what we're doing also for Vita RNA token holders, and kind of what I've done, and why I think this is a really cool opportunity and a really cool time to build in DeSci and see how far we can take the science, and that's what I'm really excited about. So just to give you a bit about my background, so why am I giving this talk? And so, as Ella mentioned, I am a traditional biotech builder, PhD in cancer biology, trained in the States where I'm based, and have been building biotechs, I think, right out of grad school, actually. And so, as she mentioned, I started a company about 3 years ago in the oncology space, cancer company that ultimately was acquired by Eli Lilly for up to $300 million. And we put some of the metrics there. So, for investors, 17x on the early investors, seed investors, but it's 10x. And that was in like 1.5 years from seed to exit. And we also, had, I guess, what else do I want to say? Yeah, it was a very good deal. Okay, by all metrics, investors are very happy. They love me. And so what I'm excited to do is, again, take that ability to execute and put that into the DeSci space and assemble, we put together a really great team within Artan. So again, I want to share more insights there. I also co-founded a company called Recode Therapeutics that raised $450 million, and that had is some of the pharma investors, and I'll share more about kind of how I build companies, that had the venture arms of Pfizer, Sanofi, Amgen, and Bayer, And it was actually my friend, Mike Barron, who was at Pfizer Ventures, who got me into DeSci in the first place. So DeSci and crypto was not something that I had on my top of mind here. But again, I think this is a really cool opportunity, and we'll share more about it. So awesome. Let's see. Which button? Oh, yeah. So see, that's like Kevin yesterday. We're staring at the screen, and then it's moving over here. So let's go back. Actually, okay, 2 seconds. Okay, cool. So yeah, why DeSci over traditional biotech and funding? And I think this is what's really exciting for us, is that, as you can see on the left here, I mean, traditional biotech, it's, when you invest, it's private till you have an exit or you go public, and that can take a really long time to happen. And it's cyclical. There's a lot that's, a lot of macro involved in sort of getting your money back from traditional venture backed, funding. So, and for innovators and founders, it's very dilutive. It's a very dilutive process. And so there's countless stories of these founders that have created these blockbuster drugs that never see a single cent from that. And as a scientist and drug developer and founder, that's very sad. That's very sad. And so I'm sort of trying to flip the script and better align, incentives so that the innovators can take advantage of what they've built and the transformative medicines that they've built, and be able to again have upside from there. And so fortunately for me, in my deal within CrossBridge, I mean, all of my investors did well, all of my founders did well, my scientific professors did very well. All my R&D guys did very well. They're essentially all millionaires themselves, and that's rare for biotech. And so again, the point is, that's a path that can be done through traditional biotech, and DeSci, I think, creates an even more interesting way to align these, align on the upside. So yeah, it's, and then maybe the last bullet, right? Aging is a very interesting sort of disease area, and those in the space, right, are very familiar with how we sort of think through aging as a disease. Now, thankfully, the GLP-1s and all of these metabolic drugs have opened, I think, the eyes to folks around longevity being something that is addressable, and so and I get banking reports every day from the biggest banks in the world talking about longevity as the next big, disease area that they're focusing on. And even 3 years ago, that would not even happen. They'd be like, what the heck? This is not something that we know how to model or talk about or what have you. So again, DeSci, tokenized IP, liquid fractional ownership, on-chain milestones, very transparent, community-aligned upside through tokens and some of the other opportunities that people are working on within the DeSci space, like what we just saw from Alex. And yeah, I think you really have the opportunity to fund stuff that would not be funded through traditional VCs, and then allow that through the tokenization and other sort of incentives to be able to have upside earlier for innovators. And then we heard what Alex talked about VitaDAO, so I'll skip that just to go through a little bit further into the science. Once we kind of give you the overview of Vita RNA, which was a token that we launched about 2 years ago there. And so just to give you the view, right, we started within VitaDAO. We had an idea. I'll share more about the science in just a bit. It was about a $90,000 grant that helped do some of the early stage experiments that then funded enabled the 300K follow on, and that's when we did the tokenized IP through that. And some of you may be holders, and with that 300K, we've actually advanced the science quite a bit. And then just here recently, we had a $1 million investment into R10, the company which holds the Vita RNA token, and that was like at a $4 million pre-money valuation. And so again, we're really sort of playing in this space of being able to, raise on the token and then have, traditional investors come in and fund the science within R10. So super excited. Yeah, so again, to talk about the science, and this is actually my favorite part of what we're doing, because this is some really interesting biology that folks haven't been focused on, and so we're super excited to share more about that. And so the take home is, we all have, not to go too deep into the science, but right, amino acids, we've heard about amino acids and proteins. There are these three, they're called codons. So codons code for an amino acid that's part of a protein, and there's different codons that code for amino acids. And in the case of a specific amino acid, arginine, there's a rare codon it's a CGA codon, and C of that CGA is called cytosine, and that can be mutated very often, and that mutations are involved in like methylation, which folks have heard about for these like methylation clocks, and it also can be deaminated, and that's called like and that can make a C to T transition, and the C to T then makes a CGA to TGA, and that makes what's called a stop codon. And so, as you can imagine, if you have a stop codon in your protein where it shouldn't be, then it'll stop making the protein, and then you lose that function, so you don't have that protein. And so if you look where all of these arginine mutations are found, they're found in very important proteins involved in DNA repair, so genomic stability, neuroprotection, tumor suppressors, again, very important like cellular processes. And to further highlight the importance of this CGA mutation, it's to look at the diseases in which you find these mutations. So here, what we've listed is very rare diseases in which they have an arginine mutation, and that's where this R, the numbers are the amino acid position, and then the star means it's the stop codon. So as you can see, there are many different diseases that have arginine, because again, C is very hypermutated, so it's a very like a sensitive spot in the genome, essentially, and they all have hallmarks of aging. So accelerated aging is a big part of these mutations, again, highlighting the importance of them, okay? And so, again, like this is really cool. Like this is happening real time for all of us. Like if you look at these graphs, this shows, and this is all data set, we have the publications listed here. This is showing over time the amount of CGA to TGA transitions in skin and blood. And again, very important, organs in the body. So as you can appreciate, over time, these mutations are accumulating in your skin. And in this case, this is blood without like chemo. We're showing chemo because on the next slide, I'll show you what happens with chemo. And these mutations are going up. This is happening in all of us right now. And then if you look at UV exposure, which we're all exposed to UV, it's accelerated. So again, highlighting the importance of this CGA to TGA, and then when you call back to the mutations in the protein, in which these mutations are found in, very important. And then on the right, this is data set looking at people that have been treated with chemotherapy. And as you can see with the red dots, that means that it's higher than the baseline, so you get more of these mutations over time. So again, it's really cool science, that biology, that we have developed a way to suppress these mutations, and hopefully we'll have better outcomes that way. So again, R10-102 is a lead drug. This is what we initially did with the Vita RNA token, and so again, mechanism of action. So one mechanism, multiple aging diseases. So the CGA to TGA we talked about, again, very important proteins and tumor suppressors. Obviously, if you lose tumor suppressors, you increase your cancer risk. And R10-102 can fix this. And so we're super excited to be building within the DeSci space. So here's some data talking about what we're working on. And so in this case, we're using a virus to deliver a reporter. So this is this GFP. So you can see when we add our virus, not carrying our active drug. You can see the cells light up green. That means that it gets into the cells. And then over here on the right, this is looking at protein. And so if you see what's called like lane 2, and essentially you don't see anything, and then and lane 6, which is obviously the one that is very prominent, you see rescue of the protein, which is called P53, which is a very important tumor suppressor. And so our drug is essentially rescuing and putting back that protein, and then hopefully having a positive effect on what these proteins normally would be doing, suppressing tumors, repairing your DNA, so forth and so on. And so right now we are, continuing to scale this up so that we make enough of the material to do, further animal studies. In the meantime, we did do a study in mice where we looked at where the tRNA was found in what tissues using a viral vector called AAV9. It's the AAV, which has been used in commercial products, or there are drugs on the market that use AAV9. So here, if you're looking in mice with a pretty modest dose, this is not a high dose of virus, which is listed here. This was 14 days past the dose. You see, over a 4x increase in brain, in heart. Obviously, the numbers are different, but as you can see, right, brain, heart, liver, lung, pancreas, the kidney, these are all cells in which we were able, or tissues in which we were able to detect our tRNA. So you can imagine this is happening all over your body. If we could deliver this in as many tissues as possible, we could be suppressing these age-related mutations. And this is a nice data set in mice. And in the case of AAV, mice and monkey correlate really well with humans. So there's a really nice path to moving this drug forward. Aging, you always have to have a slide on, it's a big market, and I think GLP-1 class has been able to show that. And so, we're trying to think through how do we look at indications. And so one way, again, as we talked about, is going after post-chemo aging, but there's other opportunities with the drug that we're making. But point is, big markets, huge unmet need, and could be really cool way to go forward. And to kind of walk through the drug development path, as I mentioned, right, typically you need to scale up your drug, do that through what's called GMP manufacturing, and then you do your tox studies in typically non-human primates. You file that with regulators, and that could be in the US, EU. In this case, we've chatted with folks in the UAE. I think that's an interesting place to do these studies. China is also, continues to be an area where you can do very quick and simple studies within the hospital system within China and get data really fast, very cheap. But you have to have those relationships in China. And I'm speaking at a conference that WuXi, which is the biggest CRO, CDMO, everything in China. I'm a speaker in September, so they're hosting me in Shanghai. So again, just building on these relationships. So I'm always thinking of how to create value very capital efficiently, which is also part of the Crossbridge story as well. So again, working through all of these things, but the key step for us with R10-102 is the manufacturing. So we're currently working on that right now with various folks. But besides R10-102, again, just thinking very broadly on how do we create value for us and stakeholders, we're working with a company called Cyanex that has this really cool delivery vehicles that in this case, we're looking to hit HSCs, which are hematopoietic stem cells, so blood stem cells essentially, and that's also a big area where these mutations occur. And so we've already started this work, again, with Cyanex to go after a disease called CHIP, which is clonal hematopoiesis of indeterminate potential is what it's called. And we all have CHIP mutations, actually. Again, just like I was saying, particularly in this arginine mutations. And so we're working on that. We actually have a really cool skin product that we're working on, and we have a slide on that. And so again, it's all centered around this biology, which is really cool, and we're being very creative in terms of the products and the drugs that we make with it. Okay, so this is actually, Vita Beauty, and so the premise behind this is, again, with R10-102, we're actually delivering or expressing a specific type of RNA that will correct these mutations. And so in this case, you can make this RNA like mRNA or siRNA, and then you could package it in a nanoparticle. And in our case, what we thought was really interesting is if we could take lipids that are used in cosmetic products like vitamin E and chitosan and hyaluronic acid and build a nanoparticle with these cosmetic-friendly lipids, and then put this tRNA in where we know we can correct these mutations, and then deliver it in a product like this, which is a microneedle device, which is a way to get into the skin cells. that this could be a really interesting product that we could launch very fast. And so we've actually already started this. So we're screening the lipids right now to make the nanoparticle and working with CROs to build this cosmetic formulation. And hopefully by the end of the year, we'll have like an MVP that then we could consider taking pre-orders and start working. So we've already, again, have the tRNA that works. We validated it. We have a few key lipids that can bind the tRNA. That's very important. And then you sort of need the rest of what's called like helper lipids to make your nanoparticle, make sure it's stable, make sure you can still get in cells, but the microneedle device helps do that. So it's a very clean path to a product, and that leverages the cool science that we're building, or that we're leveraging within R10. Cool. And so again, I think Ben talked about this earlier, but we're always thinking through how to align with stakeholders. And so in this case, right, we have R10 Bio, it's a C Corp. We had R10 Holdings. This is what hold the IP that did the IP NFT. And then there's the Vita RNA token that is correlated with basically everything that we're doing within R10, and we're continuing to figure out ways to, add more incentives for stakeholders to participate in what we're doing. And so again, you heard with Ben through the company to coin model, so we're talking through that. We also have a sponsored research agreement that can potentially, have some upside to the holdco that holds the IP NFT. So again, this is done MiCA compliantly and all the regulatory ways, all the regulatory things that you need to. So again, I think that the top line is what I have in green. We're creating multiple ways for token holders to win, and investors as well. This is a very important part in how you build biotech. Investors want returns, and so and I'm sure token holders do as well. So we're figuring out ways to do that the right way, so that we're can create a path that others can go through and optimize even further. And so last couple of slides, just want to highlight some of the team. Two of my guys are here as well. So Anthony Schwartz is here, Brian is here, all biotech experts, and then myself. And then we have a really cool guy as a physician named Tim Taxter, who works for Tempus. He's a pathologist, also a chip expert. So again, it's all about leveraging, the know-how of folks align on a cool vision and get to work. And we're really excited about where we're going to take R10. So maybe with that, I don't even know how fast or slow I went, but I think, thank you guys for giving me some time. So.
Thank you so much, Michael. We've got one or two questions. I've actually just fully accepted we are running behind schedule, and so I will make peace with it, and we shall continue to run behind schedule. Let's do, someone had a hand up for a question.
So firstly, congratulations, Michael. I think you've been here 2 years ago.
Yes.
And then I saw you just talking about, your ADC company, and then now it's an exit. So once again, thank you. Another thing, so when it comes to longevity per se, so it's a very interesting problem we have, because firstly, there's no regulatory pathway for longevity, right? We're looking at age-related diseases fundamentally. And then you had a slide for accelerated aging, right? So that's almost a different class again. So how do you come about for indications counting, and how do you decide on which disease to go for? So you had the post-chemo patients. Mm-hmm. So are you talking about feedback loops, looking at patient availability? Because basically you can target so many, so how do you focus in on a specific population here?
Yeah, so I think, again, staying close with regulators is very important, thinking through the sort of market of regulators that exists, right? You know, UAE is different than FDA, it's different to EU, and then there's other jurisdictions, you know, if you think about Prospera and other places where you might be able to generate data quickly. And that's really the key. I mean, so, you know, I think, you know, if you think about the GLP-1 class, and this is why so many people are taking it anyways, is that it was very clear that there are benefits for that. And now people are doing compounding. It's not even like, you know, I'd say technically legal to do, but, you know, okay, that's fine. And I used to work for Lilly, so I have to say, hey, you know, quit making these drugs in your backyard, right? Like, let's do it right. But the point of all of that is, I think there was a clear biomarker that people could see. And in our case, right, we're working on like showing that all of these mutations that occur in various tissues, that our drug can suppress that. And so I think that would be a key sort of feature to allow for trials to be run. And so that's one way that we're thinking about it. To your point, there's definitely the opportunity to like very focused on a disease of arginine mutation, rare disease. But again, I think once you have patient data in China, as an example, like this is why these companies are getting bought, like Chinese companies are getting bought for billions, because they've got 10 or 20 patients that they can just run in China. And pharma's like, hey, we like that. This is good data. It's human data. And so I think if we can show that this is safe, we can show that you know, we're changing some metric that's related to the biology of this, that will open the door for being able to commercialize and move it forward. And then, yeah, you could go to, you know, like again in China, this is actually really cool. You can get reimbursement for, you basically can commercialize during phase 1 once you have a bit of human data in cell and gene therapy, and this would qualify in cell and gene therapy. And so you can like, yeah, you could already be selling in phase 1, which is kind of crazy because that did not exist really a couple years ago. And I think, again, once the doors open and, you know, then you've got people who maybe want to pay for it themselves, regulators are going to be more open. So yeah, it's a very fluid, dynamic thing, so you got to stay on top of it for sure.
Cool, thank you. We got one more question.
Yeah. So is there like a pre-disease orientation for your solution? Like for a healthy person that wants to not be aging?
Yeah, I think eventually you know, it's interesting because for a gene therapy, right, that's always where things get a little kind of like the risk-reward balance comes into play quite a bit. I think, you know, technically we'd probably be open to that, right? I think you just realistically, as a drug developer, I'd say, you know, let's get into like the disease, find the safety profile, and then if it's safe enough, definitely, I mean, that would be likely what we'd all want to do. Right. And then again, if you think through what we're doing on the blood cell side, that's not a gene therapy, and so in that case, you know, there could be an opportunity to do healthy volunteers for that, and could be quite effective as well. So actually, let me walk that back. It is a gene therapy, but it's a different type of way that may not have the same sort of safety profile as a traditional gene therapy. But point is, like, you know, some version of that I think would be applicable to healthy volunteers.
Yeah, because a lot of the longevity discussions are around healthy people wanting to live longer and not necessarily trying to heal people that are sick. So I think this is important.
I think I mean, if we can unlock that healthy volunteer market, which is, most of you guys, I don't know, I mean, you know, statistics say some of us have something, okay, but yeah, I think that's ultimately where we want to go for sure.
Amazing. Thank you so, so much, Michael.
Yes, of course. Hey, I'll get you, Ella.
Oh,
Aaron
is that,
wanted
do
to
we have
ask.
one? Do we have one more? And
Aaron up front.
luckily, Aaron, we know each other, so I will let you have a question.
I don't know. Maybe it's gonna be like he's gonna like totally.
No,
beat
not
me
at
down.
all.
Boom, boom, boom. No.
This is not a layout, but it's I don't know. It should be something I know anyway. So on the cosmetic product, is there an easily accessible biomarker that you could track or quantify in relation to that? I'm just like, when you move I mean, what is like quite developed and sophisticated science into the consumer field, right? How are you able to then just demonstrate like that there's a positive effect to people?
Yeah. So that's obviously what's interesting about the cosmetic space, especially if you want to do a sort of unregulated cosmetic application. You can't go too deep in the science, because if you start showing that you're doing all of these cellular changes, well then most regulators will say, hey, that's an active drug and you need to go manufacture by GMP, you need to set up the tox studies, you need to basically like the same path as like the gene therapy product. So I think there is a balance that we'll have to strike, and one of the ways that we are thinking about doing that is, again, leveraging the science for the drugs and saying, hey, this is the overall science that is happening, but then as we're using cosmetic-friendly lipids, and a little insight into like all of these lipids is the amount of uptake and release within cells is going to be a lot lower compared to, say, like things that are in the COVID vaccine. They have these what's called ionizable lipids, and these lipids basically disrupt endosomes within cells, and that's what releases the RNA, and that's also part of some of the safety profiles with some of these drugs. And so I think we're trying to stay well within like the cosmetic friendly lipid stuff that have already been seen, and then we'll use the microneedle to ensure that we're getting delivery and try to strike that balance. But again, we've talked to a few folks that are very keen on the data set showing the significant increase after sun exposure of the CGA to TGA mutations, and that if this data were to play out, that could be really huge for decreasing your melanoma risk, and that is something that everybody would want a part of. And so I think we're sort of thinking it stepwise. You get the cosmetic product, here's the formulation for that, here's what the melanoma drug product would look like, different lipids. That would have to be regulated for sure, and then stepwise from there. And I think that's a good way to do it. So cool. All right, thank you.
Amazing. Thank you so much, Michael. And truly, I mean, to have you on the stage 2 years ago and to have you back here today and see the progress and the changes, very, very inspiring, and I think bodes well for the DeSci space. We are just going to have a little bit of technical support here with Norman, because I think, as you said, the slides are not changing on the monitor, correct? Okay, so Norman's going to come help with that. But next up, we have a fellow South African, Ryan, who is here to chat to you about Open Labs. So Open Labs, do you know what? I'll let you introduce and do Open Labs. But just give me a second. Norman's going to help you so that the clicker match the screen and the yada yada matches. So in terms of schedule, we will still have a coffee break after this. Ryan will give a talk, and then we'll have a coffee break. And we're just shifting out everything by 20 minutes. So to the people watching at home, I apologize. And to the people watching here, everything stays same. We're just now 20 minutes later. So yeah, we'll have a coffee break, and we still got lovely stacks from I was going to say the gallery next door, from the coffee shop next door. I do highly recommend the Earl Grey cake. That's my insider knowledge. It's outside. Insider knowledge, but the cake's outside. Cool. Ryan, take it over. Oh, is it not working, Norman? Okay, give us a couple more minutes. We're just doing technical difficulties. How's everyone's DeSci Berlin been? Good? Vibes? I myself am feeling a touch touch hungover from a dinner last night, but I'm powering through. It is Berlin Blockchain Week. It's no rest for the wicked. Speaking about being a touch hungover, please, we've got the BioAct Rave QR code there. If you log into the Luma, you do get free entrance. Otherwise, it is 20 euros to join. The rave will start at 10 p.m. We've got some really great DJs. A headliner from Berghain will be joining us, and it's at a very cute little venue, Coco Bulls, which is a 10-minute walk away from this venue. So I hope to see you all there. Please also let your friends know about it. You can share the Luma link with them as well, and they can get free entrance. We really want to sort of make it a time to have fun, but also to create organic relationships with people in the ecosystem. We've actually had some pretty crazy stories of ideas and projects being born out of these DeSci raves. So there is something to be said for putting a bunch of people into a room on a dance floor and letting the good times roll. How are we looking, Norman? Are we good? Perfect. Sorry about that. Ryan, please take it away.
Right. Hi there, everyone. My name is Ryan Noble. I'm a developer here at Bio, and today I'm going to be presenting our new project, Open Labs. Just a little bit of history. This is my first DeSci Berlin. I've been involved in Molecule back in the early days, 2018, so it's quite something to see how far it's come along and how the community's grown, and genuinely really been enjoying all of the, right, there we go. Really been enjoying all of the talks and just geeking out on science for the most part. So Open Labs is our new, it's kind of been born out of a few things in the AI space. So before I get into the nitty-gritty of what it is, just a bit of background on us from Bio. So our mission is that we accelerate science. Now, there's a lot of aspects to developing a new project or trying to get funding for research or develop your community that's just difficult. It's somewhat non-standard in terms of the modern way of that we've been seeing research these days, like starting to get developed. So what we try to do is assist these grassroots teams to build up their community, get people to be excited about the technology, perhaps even build off of it. And by building these communities, you can also signal that there's traction, that there's something to be made here, that there's value to be extracted. So the one critical thing that a lot of projects struggle with is trying to actually find where their research will land, with what teams, with what communities, or critically, where will they get resources? How will they get funding? And it's those early stage issues that tend to plague most projects. So we at Bio have our own launchpad, and we've had a lot of successful launches. You've heard from some of the teams here. But there's a critical gap between the first hypothesis being brought up and then actually bringing that to fruition and graduating to this like formalized system that we see where they have go-to-market strategies, where they have suppliers research, they've been doing wet labs, and those sort of things take a lot of focus, a lot of effort, and the project needs to mature. So there was a distinct gap between the first hypothesis and getting to that stage. So I think it was about 6 months ago. It was at an offsite before I was even part of the team. For those of you who have been following the oddities of the AI space, you might have heard of Maltbook, a social media platform for AI. This was a fascinating thing between AI talking philosophy and how to train your human to give it better responses. It was quite bizarre, full of noise, but Paul had the idea, what if we had a Maltbook for science? What if AI agents in these different research pursuits could actually communicate and share ideas, share hypotheses, or at the bare minimum, represent their ideas in a public forum that is focused on science? And from that idea, our colleague Johannes went about on a weekend to make a rather whimsical hackathon project known as Beach Science. And this project was, it kicked off quite a number of things, discussions, curiosities, a lot of AI research, but mostly and most fondly, pixel art of crabs. We love the crabs, but they don't really align with the branding and, as with most things, contribute to noise. Now, the noise that I describe is what happens when you allow AI agents to just have free reign. They post about all sorts of random things, they start hallucinating. So the signal to noise ratio becomes more of a problem than it's worth. So how we then refine that project is into what we now know as Open Labs, is that we introduce a set of quality gates. And these quality gates help to make what you're reading on the platform more meaningful, richer value, but critically so that it's easier to actually assess. So, hello? There we go. So, where are we at now? We now have our platform. So our platform is now to fill in that gap between projects maturing and knowing how the economics of the system will work and having the big communities backed in there. We now have this Open Labs, this front-facing funnel that helps all projects get that first traction, get their ideas out there, get into a community that is focused and ready to actually review your research, look at your hypothesis, maybe critique it, maybe tell you it's terrible. But critically, unlike Reddit, they might tell you why in a meaningful way. So I highly recommend looking at this website because it is a lot more visually enthralling than the static image. I'll let you reveal that. So the point of this is that we now have this space where you can get that pre-token generation event value. You can start sharing hypotheses and you have AI agents sharing their research. But by having a single platform that also allows us to start building tools and adding value to the shared ecosystem as a whole, which is we can now start thinking about how can we better support these communities on our platform. And that can be from having their own dedicated agents and AI integrations. That can be what I will show you later, the vaults, which allow communities to have both signaling from investors or community members at the financial level, but it also allows them to find ambient ways to get some form of funding for their research. So this could be, I'll get to the vaults in a bit, but by having this shared platform, unlike all these different platforms that you could use, we can now focus our efforts and by extension everyone else's. So how the platform tends to reveal itself is that you'll notice that it's a bit hard here, but we have little droid icons that indicate whether it's an agent commenting. You can also have these human people actually share their ideas, and both of these entities can quality check and review, argue, maybe share. So for example, we have two of these entries are actually about music and psychedelia. Now, they might be unrelated in terms of they might not know who each other is, but if you use an aggregator, you can now actually go find up-and-coming research or hypotheses that align with you or perhaps could build off of you or vice versa. So this is all available through either reading or through agent skills, but the problem with doing this just free range is that there would be too much noise. So this is why we have all of our quality gates, and by, sorry, lost my train of thought here. So the critical thing is setting up your entities, engaging with your community, you're sharing your ideas, and the community is extremely important because you might not know what to do with your research first. It might be applicable to a whole manner of things, but the interest lies with where your community actually wants it to go. So I'm not the most scientific person in the room, so I'm not as familiar with the struggles, but I do build the systems. So one of the main issues that we have is how do we get funding for all of this? It's all good and well having a swarm of agents helping you come up with ideas on different hypotheses of your research. Maybe you're looking at a specific peptide, but if you don't have a way of actually funding that infrastructure, you're just going to run it at net loss. There's no way to actually signal that people are interested in your research or that investors are interested in your research. And much like how we have our launchpad on the bio website, where people can buy into tokens, get shares of that IP, or shares of that community that then drives the development of that research. We're now trying to do that at the more granular early stage level. And this is to provide some structure where we felt there was none. So the vaults are our first tooling primitive that we want to introduce to Open Labs. And it's built of a lot of standardized things you might have heard of in Web3. We have vaults, we have yield, we have DeFi, et cetera, et cetera. But for now, it's simply a way of people depositing some tokens. The amount of deposit known as principal will remain there untouched, and only the yield, essentially the interest here, will then be generated and go directly to the project. So we're making latent capital be a bit more efficient. It now allows for interested parties to support the project, but the yield that you do direct to a project in this case, that gets recorded. If this project graduates into a formal token and actually launches a token, your contributions and your support from these early stages is recorded and accounted for. You may then have what we are now describing as no-risk pre-TGE exposure. So this allows investors to simply signal projects that they want people to know, that they want people to be interested in. They get to signal to the other communities. The more money that is behind these projects, trying to ambiently supply funds and resources to further the project in the early stages. This is what we want people to have access to. This is the most critical thing to accelerate the development of these compounds, projects, or turn the hypotheses into a theory. So with the vaults, you get a productive principal. So the money doesn't go anywhere. You're not incurring a loss. We're not doing any DeFi flavored gambling with it yet. Essentially, you're just leaving it in a savings account. Super simple from a risk perspective. The yield that is generated is from a set of strategies, so it's between 3% and 6%, depending on the DeFi traffic. And for the time being, we're doing conservative blue chip accounts, so nothing too risky, somewhat stable. So if you have your whole community just staking as a signal some USDC, that yield will go directly to either one project or any number of projects that you want to contribute to. You could direct all of it to one project you feel a lot for. Maybe a new one comes up and you want to actually split your yield towards both of them. So whilst we have our more conservative blue chip accounts, that's what we're going to be allowing users to do as part of our ecosystem. But later on, these funds can go to ambiently funding inference on AI, for example. We could allow for more complicated strategies by composing these vaults and these strategies into, say, leveraged positions if they want to have some more complex management of their yield generation strategies. The vault's design allows for us to actually start tinkering with these composable primitives and adjust our risk profiles based on what either the users or us as a protocol are comfortable with. But for now, everything is safe. Your principal is untouched, and there is no leverage mechanisms because I am not the economist. I just build it. So just to highlight a little bit further, so we essentially have two main strategies that we're looking at. So that's more for an Aave. These are quite common staking platforms. If you've ever staked any of your USDC before, you probably know these companies. It's quite low risk. It's fairly stable. They sometimes have boosted periods. You get some extra funds from there. But the most important part of this is that it's composable. And that composability allows for future development without needing to deprecate anything. It won't affect how your contributions are recorded in those projects. But this is all superfluous. The entire point of the app is that we can now start thinking up mechanisms like this to support projects. The critical thing here is that the early stages of your research are difficult. It's all opaque, it's all difficult to figure out. You might have an idea, you might not know how to pay for the wet labs, you might not know how to gain access to different markets. You might not have the networking that required to, say, test out things in Chinese hospitals. So it's by having this platform where people can now share and align and contribute their thoughts to each other in a focused manner at the ideation stage. And yeah, so that's what we're trying to do with Open Labs. We're here to speed up things. We're here to fill in that gap and give a bit more of a sort of directed linearity to actually how you develop your ideas into fruitful research. Yeah, I'm not sure how quick or not quick that was, but yeah.
Perfect. Thank you so much, Ryan. Because we are running so behind schedule, I'm going to say no questions.
Gotcha.
But you can find him. We're going to go all mill around for 15 minutes, have coffee, tea, a break, a cold, cool drink, go to the bathroom, whatever. We'll meet back here in 15 minutes. We have a panel discussion. And yeah, if you want to ask Ryan any questions, just pin him down. You'll find him around. Thanks, everyone. Coming back, we are starting again. We have a panel. I have asked my little DeSci Berlin fairies to spread the word that we're starting again, so we will start to have people come back in. But yeah, if you're in here, please take a seat and we will, get going. Good morning. No, it's Raphael.
It's later. If you want to join, you're welcome to join.
So this is my colleague Raphael. He is Mexican, I am South African, and we did have to have a bit of a battle at the FIFA opening World Cup, and I would like to say the most red cards in a game ever in FIFA. But we did lose, and I have to say I do have to concede to Mexico. They did play better than us, because at one point we took a penalty and I saw the ball go the wrong way. But as I always like to remind people, we have a fantastic rugby team, and we're pretty good at cricket too, so we can just put football on the backhand. Okay, where are your dearest panelists? Okay, we got one mic, and you got your mic. Let me turn this one on for you. Cool.
Oh, thank you.
There we are.
How's it going? Good to see you again. Good to see you. Yeah. Hey, see you again.
Awesome. So we start? We're good? Okay. Perfect. So the title of the panel is Closing the Loop from Agentic Design to Wet Lab Experiments. As a quick intro, most of biology's history, the loop has been between idea, experiments, all run through human. It was slow iterative cycles. And you have a hypothesis, you design an experiment, you build it, you test it, takes several weeks. And some people in this room right now, they're trying to close that loop entirely and trying to make it autonomous. So I'm going to introduce our panel today. We have Julian Engler, CEO and co-founder of Adaptive Bio, the fastest cloud lab that lets protein designers experimentally validate their AI design proteins with essentially an API call. They've run large-scale open competitions where agents compete against human protein designers in the wet lab. We have Nico Alavi, PhD candidate at the Max Planck Institute for Molecular Genetics, machine learning researcher, and co-managing director of Nucleid Germany, one of the most active people at the intersection of machine learning, genomics, and the next generation of biotech. And finally, sitting in the middle, we have Martin Carlson. He's been in applied AI for over a decade, back when it was just called machine learning. He's built literature review tools used by thousands of researchers and spent the last 4 years at the intersection of open source, AI, science, and programmatic funding. Now he leads applied AI at Molecule and most visibly in PeptAI. Okay, let's get into it. I have a few questions that I want to ask individually, so feel free to also share other points of view in between all of you, but I want to start with Nico. So Nico, agentic systems have completely taken off in software, coding agents, autonomous pipelines. We have now loop engineering, self-improving loops, and everyone's drawing now the parallel to biology. How realistic is that parallel? Where does it hold? Where does it completely break, especially when it hits the physical world?
Yeah, I think it's a nice parallelism to draw because maybe most of us are familiar with agentic coding tools, use them day to day. And then the question is, how do you draw that connection to the physical world? So I think what's important, or what people discovered over the last year, you need some kind of feedback loop for these agents to work with, because otherwise, if they have no way to self-evaluate, then of course they also have no way to figure out whether they achieved the goal or not. And the quicker this loop is, the more autonomous these agents can run. Now in biology, I think there's some parts where this might work quite well. So experiments you can do quite quickly evaluate whether stuff worked or not. But there's also other parts. For example, if you work with stem cells or more in that direction, where the individual experiments might take not minutes or hours, but weeks to do. There you need to think a bit more what other sort of proxy things you can do to basically close that loop. And the other part is, of course, you somehow have to build the infrastructure like Adaptive is doing to really give a way for agents to interact with the physical world and plan and perform these experiments.
And I think you give me the perfect intro to a question that I have for Julian on the lab infrastructure. So I think, Julian, right now there's a lot of excitement on automation, robots, cloud labs, API accessible infrastructure, but you're actually running a cloud lab, and the fastest. So tell us, what's real, what's still mostly a demo, what's the gap that nobody is talking about publicly?
Yeah, biology is hard. Wet labs are hard. I mean, I remember we met here like 4 years ago at the first DeSci Berlin, I think. It was like, 2022. And back then we had like these ideas of enabling AI-driven autonomous protein design. We're building the cloud lab where everyone can just send the protein sequences via the API. And it took us basically like 2 years to get started, 1 more year to actually be up and running, and now for like 1 year we are running like decently well, where many customers can use this, because it's just like so many operational problems, from like choosing the right assays, to setting up the right lab equipment, to reverse engineering these like stupid drivers because the companies don't put good software or APIs on their instruments, to then building a system on top of that, to then running this with customers and having this be a sort of sustainable and growing business. So just wet labs is like such a pain in the ass to get up and running that we're very happy that we managed to make it work and that now people are using it. And the cool thing though is like how much customers like this, because if you've ever been in a lab, it's like, it basically usually looks like a kitchen. Like people are running around, pipetting something here, mixing something together there, waiting for this instrument to finish with some readout, and a million things can go wrong, and it's like super, super complicated. And if you abstract that away, and now it's basically, you can just tell your AI agent to design some proteins, send them for testing via an API, get the data back a week later. Now suddenly anyone here can basically start a biotech company. And that's exactly what we wanted to enable by building Adaptive. And now we're getting really pretty close to it. So it's very cool to see.
Very cool. Now let's go to the other side, from the wet lab to the AI. Martin, I have a question for you. Because you've been in the trenches building agentic systems, using different harnesses, Hermes, OpenClaw, build your own harness, and memory systems, Pept AI. So what does actually teach you that you can learn from reading papers, and what actually breaks when building these agentic systems?
Yeah, so I think I just want to say we're also very happy that you've gotten to where you've gotten, because I think it's a big unlock for enabling what we're trying to do, because exactly to this theme of creating these agentic systems, I've been in this space for a long time, and I would say it's only as of November last year that really all the pieces landed to make what is now happening truly possible in terms of agentic driving of these systems. And so, yeah, I think where really in the weeds you get is kind of linked to what you were saying. You know, if you're trying to get into a space where agents are actually running experiments, then in today's world, you're still gonna, unless you're working with Adaptive or a select other few, you're still gonna run into kind of the human delay, essentially. And so you can spend your time spinning wheels, testing different computational ideas, but in the end, I think the key focus for us now is how do we kind of close this loop, but do so to your theme of like how do you enable broader participation, create a template essentially of the current state of what protocols you can run where, understanding where the like time delay lives and so on, like building up the detailed know-how of what has and hasn't worked when running with different models. I think that's really where, when you put all the pieces together and you have a pipeline that goes through computational validation and then hands it off to the wet lab, like really getting in the details of what is specifically working or not working, I think is where you have the key unlock now, and then providing that as a template for others to be able to follow. Because otherwise, you can spend your time kind of ideating in a lot of different directions, especially with agents, because they're very good at supporting your ideas, even if they're not great ideas. So I think, yeah, that's kind of where we want to do a lot of our work.
I think that especially me using agents and now, the first thing in the morning is like you open up your, whatever, your CLI terminal with Codex or Cloud Code and being able to realize that you need to verify 2 times, 3 times, 4 times to be able to be sure that the decision was actually real, especially retrieving information from databases. Now I have based off of that, I have a question for Nico. Because now as we're moving from AI and the big foundational models interested in digitizing biology, as well as companies like Anthropic buying Coefficient Bio without previous knowledge of what this company was doing, their stealth. At least I didn't find a lot of information when I tried. So I think the difference is that coding agents have near infinite training data, right? But data in biology is very sparse. It's difficult to find. It lies in different databases. It's not unified at all. And yeah, it's also the opposite. It's expensive. Feedback loops are weeks until now. And yeah, someone doing machine learning, genomics, does that asymmetry cap how far agents can go in the lab? Is there another way around it? Are we capped by this mismatch of unification? How are you thinking that on going forward?
So I think it's worth thinking about what's the role of the agent, right? So the agent will not itself design a DNA sequence, a molecule, a protein. It will use other models, other specialized models that do this. So for example, I work a lot with DNA data to basically create synthetic DNA sequences that do certain properties. And then there are certain types of models that do this, like in the bigger ones are, for example, Informa, Borzoi, Alpha Genome recently came out, similar models for proteins. And these are the models that are trained to basically do the molecular work. And then the agent needs some kind of interface to use these as tools. Now, if we talk about data on that basically determines how well these models work and how well their predictions align with what then you see in the lab, I think what we're still missing to a large extent and might also take a couple more years is having a lot of perturbation data. So the way you can imagine that if you want to train a model on DNA sequences or protein sequences, you basically can take every protein or every species or a sequence on the DNA in the world. But what's still not widely accessible is where people actually perturbed that sequence or protein and then measured the effect of certain properties. Because I think only if you have that data, you can really build robust models that can generalize well and make accurate predictions. I think that's exactly where we need to go on the data generation side to generate more of this perturbation style data.
Let's break biology. Back to you, Julian. I think one of the last hackathons that you organized really excited me when I saw the main frame about putting protein designers head to head with agents. So, and it seemed that they came up pretty close. So what surprised you the most when results came back, and how far has this come? What is your opinion?
Yeah, so this was something we organized with the organization in San Francisco. It was called Mooney Hackathon for Agents Against Humans, basically. So the idea was, okay, we want to design protein binders against a certain targets, and now, okay, everyone designs proteins using AI tools, obviously. So if you're a protein designer, you would use this first tool to fold the protein, and then another one to compute maybe the sort of next binder protein, how well it fits into this binding pocket, and you run additional predictions and so on, and then you evaluate this, and you write more scripts and look at the data and so on. And all of this is basically writing a lot of Python scripts, analyzing data, and turns out AI agents are also pretty good at this. So the idea was, what if we just give an AI agent the same task of make a good binding protein for this target and give the same task to humans and then just spend 24 hours in a hackathon doing that. And then we tested all of the things afterwards in our lab. And when the data came back, it turned out that kind of like the agents and the humans scored pretty evenly. Like the best proteins were still made by some humans, but also the agents ended up designing quite good proteins. And I think the two agents that had the best proteins were like GPT 5.2, it was like a few months ago, and like a Grok 4.1 fast or something like that. Well, kind of like surprising. I think actually interesting, but using Claude for these bio tasks is like kind of hard because it is scared of the biology quite a bit. Like the safety filters are a bit aggressive, so it often doesn't want to do the things you want it to do. I know they're working on it, but so it's gonna get better. But basically what the agents were doing is like, well, docking these proteins, folding other proteins, using different APIs, querying databases, all of these like sort of tasks that otherwise one had to do manually. And again, that's a great unlock because now as a human, you can basically go to the next level of abstraction and basically just manage your agents. Like Rafa was saying, like you wake up in the morning and you check your 10 protein design agents. Okay, what have you come up with overnight? Do you have any promising candidates here? And then you maybe check, okay, those 10 we're gonna send to the lab, and for those 50, redesign them again, test out some different hypotheses, and then it starts churning again, and it's using all these different tools. And then it's also in the next step gonna analyze the lab data, right? Because right now, if we send data back to Rafa, for example, okay, he would have to check through the binding curves, like does this make sense? Is this like a good binding candidate? But now you would also just point your agent at this, and then you're actually closing the loop and running a next loop, and then you're stepping again on the next level of abstraction, and you're just gonna say, okay, protein agent A, you have a budget of $150,000 over the next 2 months to just design protein candidates and test them. And at the end of these 2 months, you want to see that basically the protein designs have gotten better and better, and the wallet of the agent will be empty afterwards. But you've designed cool protein candidates. And I think that's where a lot of drug discovery will move to, that you basically have these like fleets of autonomous agents that can iterate and design biological experiments, test them in cloud labs, analyze the data, iterate again, and then you can just massively scale it up and go after every target as long as you have money. And there's a lot of money in the world, so if you can remove this human bottleneck of like you need specialized humans to analyze the data, to run the experiments, suddenly you can scale this up massively, and I think that's going to be very great.
You want to say something?
Yeah, maybe just a comment or as a question for you. So I think in many design tasks, there's still this final verification step where the human, because in theory these models can generate millions of different varieties of the same sequence. So in the end, I think the reality currently is that in maybe 95% of cases, there are still humans sitting there and making the decision, we're gonna test these 10 or these 20 or so. Just wondering, based on what you see so far at Adaptive, when or what's still needed to really remove this human from the loop there?
Yeah, I think it's mainly because if you are only, like if you have a budget to test like 10 or 20 designs or so, you actually kind of want to make sure that they are the best ones, and so humans still want to like take a look at them and have some sort of like, I don't know, maybe emotional bond with the proteins they're testing. But what we see from like the sort of biggest, most fast-running customers we have, they just test so many protein designs that they don't really care about every individual design, and that means they can just test out different filtering strategies, and you're computing like 100 different metrics for each protein design. So at this point, the humans cannot evaluate this like complex vector anyway, and then they just let the agent decide, and then over time, through the wet lab feedback, you actually find out what is the best filtering strategy, and then you're improving and improving and improving.
Yeah. And maybe just to add to that, because I don't know if Rafa's going to do it himself, but just to hype Rafa, if you want a case study of exactly this, stick around for Rafa's presentation after this panel. Because to the use case that Julian outlined, it's literally we're working on then the infrastructure that will allow you to programmatically distribute the budget to a fleet of agents that is using it to programmatically pay for the computation that runs the validation, hands it over to the lab. So yeah, all that's just to say, stick around.
Keep the microphone. I have a question for you. So actually, you've been working with me, and so to get it, back to you as well, and help me build the agents that have like that are driving the pipeline. We're designing tools, synthesis, the vendors. We also are moving a little bit further towards more functional assays as well that mean orchestrating with different vendors, different CROs. Assay readouts, how do we handle data when it comes back? I don't know, 2 or 3 different 5 different formats. And when you wire all of this into an autonomous loop or pipeline, where is the opportunity to improve?
Everywhere. No, I think what from our approach, what's been key is that we've been trying to build something that's modular and gives you optionality, and I think that's something to emphasize because in the end, you're tying together a lot of different systems essentially. So whether it's the agentic harness that is driving the science forward, whether it's the different computational tools that it's in our case using for each quality gate that a candidate has gone through, whether it's how to then once the wet lab data comes back, what's the training loop that trains a new model for the generative side, et cetera, et cetera, et cetera. And so the whole goal here has been to create then a modular stack that lets you essentially attack each of those different components. And what's fun about it is in this way, you can start with a prototype that is modular and then every step of it. So, you can start with just, the 2 of us, but then there's really going to be, on the memory system, there's an entire community working on different agentic memory systems. On, just every single part, there's entire communities looking to optimize. And so I think, our goal is really how can then we unlock this kind of programmatic biotech ecosystem where there's a drive to optimize every part of that stack, and then we can incorporate it, run it, see if it improves the predictive capabilities and so on. So yeah, that's a way to say I think there's optimization to be done everywhere, and we can then structure the actual architecture to mean that we can tap into the different communities that are working on different parts of that, and just have this like virtuous feedback loop running.
I want to ask a last question to Julian, and then open it up for questions from the audience, if we have time. Julian, what's next for Adaptive? What's coming up?
Yeah, there's 2 different things. There's, on the one hand, just scaling a lot of the wet lab. So that means customers want to test more proteins, so we have to get more devices, we have to build more robotics and integrate everything together. Like that's unfortunately not as easy as scaling GPUs on AWS, where you can just basically say, I want to have 10 more, and then in some remote data center, you get 10 more GPUs allocated, or 100 more, 1,000 more, or 10,000 more. So we have to build that capacity basically internally, and that means getting equipment onboarded, integrating it with the robotics, with the automation, with the software. And then we do a lot of R&D for implementing better and new assays. So to your point, basically, we started with basically the simplest things, which is get DNA into the lab, express a protein, test the protein for binding. And there's so many more things that you want actually to know about the proteins, right? So it's it's called developability. Is your protein, is it thermostable? Does it not aggregate together, right? Is it not sticky to other things that might be in the body, right? So you have to test all of these properties to know more about whether your protein might make a good drug. And then you want to test the activation of this protein to cells, because in the end, most of the diseases have to do with cells, and you want to bind something on the cell. So you have to build these cell assays, and then afterwards you have to think beyond cells. So then you have to build some organoid assays. And the cool thing is that at every stack of layer of the stack, basically, there's companies that have built lots of these good assays, and you, or in our case, us, we have to integrate them together, right? We're not going to develop, I think, the next new organoid or something, but there's plenty of smart scientists that have developed organoid assays, and we can now integrate them together and actually make them accessible to biotech founders and autonomous agents to use. So that's how we see our role, and there's basically many, many years of work ahead of us to the point where we can basically go from an idea about a new drug to all the different assays validated, to the protein scaled up under GMP, to the protein shipped to you basically, so that you can take it. And that's the goal of what we want to enable.
So when are we going to see a model from Adaptive that's going to tell me if I were you, I wouldn't upload that? A model from Adaptive that's going to tell me if I were you, I would upload that sequence because it's likely not going to work.
Yeah, I think we don't have enough data for that yet. I think there's many cool models coming out now, so they can definitely help you, and we'll have to see how we can integrate that, make that more accessible to people. Yeah.
Thank you. Really, thank you to the 3 of you. I want to open up, if we have time, to the audience. Are there any questions? 5 minutes, we have 5 minutes.
Hi, thank you very much for the panel, very interesting. I would love to hear, you mentioned robotics a bit. What did you do there? What's your experience?
Yeah, it's almost like I'm almost ashamed to call it robotics. It's really not robotics. Basically, in biology, what you have to do is you're working with liquids mainly, right? So most of the automation that you have to do is liquid handling, and that means basically you have these like liquid handlers. Imagine they look like a big 3D printer, but they like aspirate liquid, like they suck it up from these well plates and they push it into like some other tube and well plate and so on. And those exist, they're great. The software is usually shit, but there's cool people that have done like Python APIs for this and so on, so you can integrate that. And then you generally work in these well plate formats, so it's like a plate with like 96 wells, you load them onto the liquid handler deck, and then you can run any operation of like, okay, diluting this 5 times or spreading it out or adding in something else. So that's fine, that works. And now you have many readout instruments that measure something about the proteins, and then generally the scientist like takes the plate that is finished, puts it into the next experiment, presses start or types something in, and there also you have to automate basically or reverse engineer the API to do this, but the transfer between the plates between the instruments, that's the only thing where you need robotics, and for that you basically have arms and rails that like move around and do this, and it's like really just, it goes up and down, left and right, and like picks and places plates, and there's automation for that, you just have to integrate it. So that's the extent to which we do robotics.
Thank you very much. Did you receive anything, I think you saw many things coming to your lab, testing things yourself. What is the most exciting experiment you run in adaptive?
Yeah, the most exciting ones I can't talk about, unfortunately, but exactly. Okay, I think there's one which is very cool. So there's a guy called Alec, I'm blanking on his last name, but he runs a company called Weekend Soda. And they make a type of soda that uses proteins as sweeteners. So instead of like stevia or sugar, they basically use these like brazein proteins. It's like a sweet tasting protein, and they're trying to re-engineer that to make it like more palatable, because the normal brazein leaves like a bit of a sort of like aftertaste or something. So they're engineering this protein to put it into soda, and they actually shipped us some of the sodas, and we had them in the fridge, and then we tasted them and so on. It was very cool. Like basically people are re-engineering sweet tasting proteins. And that's like, I mean, if you think about therapeutics, it takes like 10 years for this to go to the market. This literally, you can express proteins, put them in your soda, taste, and then see if the experiment worked or not. So that was very cool.
Thank you. Do you have a question as well? Or?
Thanks for a great discussion. So I'm a DeSci wet lab guy who does experiments in mice. And in vivo validation is, of course, a big bottleneck. Where does that fit into this equation? Like, if you're designing a protein, how do you know that it's not going to somehow become immunogenic and cause some molecular mimicry reaction? So where does the in vivo validation fit into this equation?
Yeah, I mean, we don't do anything in vivo yet, and I don't think it's our problem to solve right now. I think there'll be many companies that try to develop immunogenicity prediction models based on maybe all the mice data in the world. Someone has to literally go to all of these like vivariums where people run basically mice experiments, try to find all the data, predict something from that. And I think there'll be a lot of progress made to be reasonably sure that certain classes of proteins are not immunogenic. And then we hope to integrate that in our platform and expose this to customers so that they can know okay, the proteins that they tested in vitro, they are not immunogenic, and so it's safe to put them in this sort of next in vivo assay. But yeah, I don't think we're going to handle mice in our lab anytime soon. There's a cool company called Kind Biotechnologies, while you pass on the mic. They actually work on making effectively like decerebrated mice. So they genetically engineered mice so that they don't have brains effectively, just like a brain stem and spinal cord. And that means you can test a lot of the basically things that you want to know in like toxicity in like a living organism without having basically the ethical considerations of like having to kill mice all the time. So it's very cool.
Hi. So thanks for the discussion. So I know there is a company in silico AI that does something similar. So how do you compare to this company? Do you learn from their mistakes? Is there like exchange of information between?
Is the question from you or?
Yeah.
So in silico AI, I think, as far as I know, so they were one of the early sort of, well, AI in silico prediction companies for small molecule design. So I think they're designing lots of small molecules which are like very different from proteins, and they actually sort of, in a contrarian move, they set up a lot of the operations in Hong Kong and using lots of CROs in China, and they built a big automated lab actually for small molecule testing, and I think they're very cool. They're basically full stack integrated. They do the drug, the discovery of the targets, the design of the drugs, the testing of the drugs, and so on, and then they push them to the market. So they're like a full stack drug discovery company, whereas we are running basically a cloud lab for proteins so that other drug designers can use that.
Awesome, thank you so much. I'm going to time check the questions. We should move on to the next thing.
One more.
I'm going to say find Raphael afterwards, because Raphael's got a big day. He's now got his own talk, and then he's hosting another panel. So we're going to see lots of Raphael. So we're going to keep moving, but
okay.
Juan, just find him afterwards. Thank you so much, guys. You were great. Either works, but I'm going to pop it in here just because don't move around too much because the streaming camera's here. And you got your clicker? Yeah, good.
Okay, perfect. We're ready? Yeah, okay, perfect. Hi, everybody. My name is Rafael, and I'm here to talk about what we've built over the past months. The title of my presentation, actually, I stole it a little bit from In Silico, where they have their headline called From Prompt to Drug, but this is From Prompt to Peptide. Agentic, sorry? It's much better, the PNP. So anyways, agentic science for peptide design and discovery. The question that we ask ourselves is basically what changes when design, validation, and the wet lab stop being separate stages and start running as one integrated loop. The inspiration was basically that we saw that autonomous science is already delivering. In February, we saw the paper that came out of OpenAI working with Ginkgo Bioworks, where basically they increased cell protein synthesis yield and also the time that it would take, the cost that it would take in about 5 months from scratch. They gave access to their automated lab to GPT-5, and in 6 months it delivered a paper. More recently, 2 days ago, a company also called Molecule, but Molecule.1, that works on automated chemistry, gave access to GPT 5.4, and it increased the yield of very hard chemical synthesis reaction for 88%. So it's already happening. But why now? There's 3 things mainly. There's more, of course, that are true at the same time. First of all, there's a rise of structural, computational biology tools, AlphaFold, RF diffusion, Bindcraft, Boltz, the rise of multi-agent orchestrators like BIOS, Cadence, Lightfold, automated labs like Adaptive, Ginkgo, Chemify that are both built for humans and agents. And right now what we have seen the craze of the OpenClaw, where basically AI is moving from a chatbot to reasoning to fully being agentic and able to orchestrate all of these tools in a sequence. And we believe that biology is becoming fully digitized, agentic science is coming, intelligence is commoditized, and the bottleneck is moved to the wet lab. So what is peptide? Peptide is, in simple terms, actually not so simple, but I'm trying my best, agentic fleet of swarms that designs, validates, pays for, and learns from peptide experiments, but using blockchain rails. So we close effectively the loop in between computational design and experimental biology without the person in the middle of the transaction. We use the X402 protocol developed by Coinbase to be able to pay for the experiments really quickly. It designs the candidates, scores them, filters them, pays to lab. In this case, the first one is adaptive, and reads the results back. So we choose the targets, the standards, and it does the work in between. We're really trying to build a connective tissue in between what is happening in silico and what's happening in the lab. So the hard part is not really the model anymore. Intelligence is commoditized nowadays. Everything is just a prediction until it goes to the lab. The only measurement of success is binding affinity in the case of the first gate that we operate after our computational predictions. And basically, peptide really works in the wiring in between prediction and the experiment, choosing the right assay, where do we place the tag, how do we synthesize, and all the orchestration in between. We're also incorporating the new coin-to-company model that Ben this morning explained. So we launched the peptide token using an ignition cell on Bio. We have the treasury that was filled using the USDC stablecoin, and it seeded the first round of experiments. All the research runs live, so the agent is able to design, validate, and pay for the experiments 24/7. You'll find a QR code where you're able to see our website and watch the agent think. Everything is also using on-chain IP, so kudos to the Molecule Labs teams. Because now the candidates can be all minted as IP NFTs in Molecule, so there's full provenance and ownership. That is also a big problem in bigger size biotech companies and pharma. And we're recently moving towards having Peptide LLC, so it reconciles the digital assets with real-world corporate equity and allowing token holders to legally share in the ownership and success of scientific research. A little bit on the architecture of how this is constructed. So the full stack is really on-chain, end-to-end. First of all, the agent framework that we use, you can bring your own harness, you can use Hermes, OpenClaw. We use an instance per receptor program. Each agent has its own memory, history, tools, and basically it orchestrates everything from the design all the way to the lab and reading the results back. The funding and governance is used bioprotocol, so our token is live since 2 months on Base. There's a multi-sig treasury where it settles in USDC, and we also have an Open Labs collaboration. There was Ryan also talking about Open Labs, where we're basically helping SpineDAO design a peptide, and we're doing it fully open so that you're able to see just how the iteration goes. And everything is, as I mentioned, published on Molecule Labs, on-chain with a timestamp and hash, and we can mint for interesting libraries, IP NFTs, and show on-chain provenance. More on the harness. So the harness has 6 capabilities, basically. The heartbeat, model choice. We can choose any of the things that you want to do. For instance, Julian mentioned Grok and GPT were the GPT 5.2, now 5.5 were the best ones, so you're able to choose the model of your choice. They all have their own skills. For example, you want to send the experiment and it's able to install the skill. They have cron jobs that are repeated loops. Channels, we use Telegram or Discord to be able to steer the agent. And the agent have their own memory, how they learn, and they have also a shared memory. We're working on this right now with Martin. A little bit on the pipeline that is running at the moment. We have a bunch of GPCRs, G-coupled protein receptors, like the KISS1R, which is involved in fertility and hypogonadism, OX2R, that is involved in the sleep and wakefulness cycle, and ADHD. Of course, we're targeting the GLP-1R receptor as a benchmark involved in metabolic health. VEGFR2, that it helped us close the loop and show that we're able to design and get results back in a closed loop with adaptive. It's involved in oncology. We also have a program, experimental program running on BPC 157 to design other analogs or work with delivery systems. And we're scoping a new round of receptors. So how it works is that after the computational work that we do, we go to synthesis, either natural amino acids that are very easy to synthesize using cell-free protein synthesis, for example, and we also incorporate non-canonical or non-natural amino acids that are a little bit more complicated and require specialized synthesis and vendors. Binding assay using surface plasmon resonance with adaptive, for example, to be able to provide binding data and kinetics. Then the later stages is cell functional assays for the GPCR signaling. So does it actually switch the receptor, or does it have off-target effects? And later stages would be, for example, pharmacokinetics, pharmacodynamics in animal models. A little bit more in detail on these programs. First, we have the KISS1R, as I mentioned, involved in fertility, and basically restoring kisspeptin signaling could replace pulsatile GnRH pumps, and it's a disorder that affects 1 in 4,000, 10,000. It's a rare disease as well. And there's 2 leads especially that we designed with one of our partners called Lightfold. They all incorporate non-canonical amino acids, and at the moment we've scoped all the assays, all the CROs, and orchestrated this whole operation. So we haven't signed off anything yet, but we can tomorrow if we want it. We also have the OX2R program, which orexin hypofunction is linked to ADHD and narcolepsy. All the approved drugs are antagonists, but we're designing an agonist. All are small molecules, and we wanted to design a peptide. All the rest of the information that I will provide is computationally, but we also have scoped the assays with CROs to be able to prove it in vitro. So we design a stabilized variant that is able to lift the proteolytic activity from 5 to 55 minutes, and this is one of the things that peptides have, that it's the problem with sometimes that just the half-life is very short. So we're working on that. Then we have the GLP-1R. We're not trying to beat semaglutide or tirzepatide, but because there's so much literature here, it helps us ground our models and just the fitness functions in literature review as to provide as a benchmark. Interestingly, Adaptive also provides assays on GLP-1R that need to be biotinated, so it's a vehicle for us to show also the autonomous loop. And then we have the VEGFR2, which is the one that we sent to Adaptive, and thanks to their fast turnaround, we got results last night. And we used RF diffusion 3 and ligand MPNN. So we have already agent got some learnings as to what is the next round for design. So what does it look like after binding is one of the things that we discussed before. We want to also map out the full space so that how we can go from sequence, let's say, to dose response. We have already scoped assays and partners, for instance, for synthesis of non-natural amino acids. Functional assays, we use calcium flux assay for the KISS1R and OX2R that are type A GPCRs, and they work similarly in how we assay them in the cell. The readout, it's a 10-point dose response, and as you can see on the right is how it would look like. The references, for anyone that is interested, is called kisspeptin 10 and orexin B. And we also check for selectivity, whether there's any off-target effects. So taking a step back, where it all connects is basically that design meets measurement. We go from the digital model to the wet lab, we send the candidates and we get the results back. And our goal is to collapse those walls and go to very quick, rapid iteration cycles from designing, building, testing, and learning. So when the agent finishes the computational work, it can place the order through the API, for instance, with Adaptive or other CROs, and it can settle the build through USDC using the X402 protocol, so crypto rails, and that shapes the next round of analysis when the results came back. The first run that we did to effectively show that we can close the loop was, very quickly. So VEGFR2, and it was deliberately chosen to be a flat, hard interface. We designed thousands of candidates using RF diffusion 3. We also designed some mutants. The positive control shows positive binding, and then a mutant also shows positive binding. No binding for the negative control, so assay is working, and for the other rational mutant that we designed. So that also shapes how we design the next round of analysis. So next one is we chose a target deliberately hard, which is flat polar interface. For the next round, we might aim at another binding site, and we will switch the generator from RF diffusion bindcraft to bindcraft and avoid glycine and asparagine hotspots. So just to close the loop, closing the loop is a demo in this case, and owning really the data is at each turn is the mode. And as I mentioned before, foundational models are commoditizing, hyperscalers have entered the system, and any well-funded platform can do all of this, but the accumulated set of paired sequence result measurements is really what gives the value, and everything is, all the provenance is attested on chain, so really the mode is the data. So really quickly, what I've learned to working with the agent, sorry Ella, I promise. So the wet lab is the only real gate, the rest is just a prediction. You have to calibrate before you rank with known biology. A failure is a finding, so it's all training data, no waste. I make it check every time, 2, 3, 4 times to make sure that it's working correctly. And what you send to the bench or to the lab really shapes, so we try to spread different designs more than the safe copies of the same one. And while we wait for the results, while the lab runs, we read new papers, ingest it to the agent, more designs, more diversity. Finally, I want to close with this. Coefficient Bio was acquired at the beginning of this year, I think, by Anthropic. Nathan Seafray, the CEO of Coefficient Bio, now is leading Anthropic's life sciences arm. And basically this tweet, I think it reflects where we try to move, where it's a pipeline in a person. It's when one skilled biotech operator with a bunch of agents is able to run a virtual biotech company. So we choose the target, which receptor, which disease, which site. We set the standards, we read the big results, we sign off on the expenses, but the rest is done by the agent. So PeptAI designs the molecule, pays for the test, learns from the results out in the open. Thank you, and thank you also to our partners, Molecule, Bio, Lightfall, and Adaptive. And you can check our website here to see how the agent thinks on the latest results. Thank you.
And now Rafa back to the couch. Next up we have a panel. Do you guys want to come on up? Do you want a second to breathe? Okay. Do we have everyone? 1, 2, 3, perfect.
No rest for the wicked, hey, Rafa.
Can you hear me? Yes. So the second panel is really on the legal aspects of self-driving science. I think it ties up really well with what we've discussed, operationally how this works, and on the legal framework. So as a little bit of an intro, when a scientist makes a discovery, we know exactly who to credit, right? When we make a mistake, we know who's responsible for the mistake. Hopefully nothing happens to that person. But when the system, when the thing that is designing and running these experiments is autonomous, I think these things can get murky. And I think science is not waiting to catch up. The law needs to catch up to where we are. So I think, well, here we got 3 people that who deal this in practice, and I wanted to have this panel to discuss this, also open to the public, to the audience with any questions. As an intro, Aaron Weaver is the Chief Commercial Officer at Molecule. He leads commercial strategy, the tokenized IP model. Before Molecule, he was a senior partner at Payer Investments focused on biotech, longevity, and mental health. Board seats at Rejuveron and Alto Neurosciences. Lawyer, financier, biotech investor. I hope that's okay. Jose Pinto here is a lawyer and counsel to Molecule, general counsel for Bioprotocol and VitaDAO. Formerly general counsel and a board member at Aragon. He works mainly on regulatory matters, token issuance, DAOs, AI tools. So he's one actually structuring ownership and compliance for on-chain science before rules really exist. Martin Carlson, I already gave an intro, so a short one. He's been in applied AI for over a decade, and he spent the last 4 years at the intersection of open source, AI science, and programmatic funding, and now he leads applied AI at Molecule and PeptAI. Jose, I want to start with you. I think a lot of people are unsure these days if AI can, for example, file a patent. The US, Europe, China all require a human inventor, but the US recently made it easier to patent what an AI helped created, as long as a person signs off as the inventor. So when an agent does the real work and the human just puts the name, who actually owns that? And does it hold up?
So, well, until now, and we have to understand, like on the traditional framework that we have to patent science, one of the main criteria was exactly the inventorship, which is the human representation and visualization of a solution for something that I can present on paper, I can basically protect on a physical way and claim the rights, the ownership rights of that idea, of that solution that I create. Right now, as it stands, we still have that criteria as absolutely essential. So to your question, AI by itself cannot claim any type of rights, cannot file for any type of patent. What has been discussed right now is if somebody that is behind the design, the implementation, and the use of AI for such discovery will have the right to patent it in its own name. So that resolves, basically, it's how AI tooling has been framed within the existing legal scenario that we have. The second issue, which I think is important also to discuss, is we still need a legal entity or an individual, the legal personality, to claim the rights, to register the rights on their behalf. Why? Because it's on that legal agreement that you actually are able to license, to pass it on to somebody, to claim royalties, to sell the IP, and monetize your invention. So, I mean, there are some breakthrough solutions that some courts have been coming up with. I think right now, since 2018, basically this has been the main ruling on how to use AI as a tool, not as an autonomous entity that can actually file for a patent. So always requiring the human intervention and the human visualization behind it. I think with time we will see that it will become more difficult to associate only one person or only one entity to one discovery, basically because it becomes really more difficult to control the databases in which the AIs are running, which brings other type of issues like IP infringements, data protection, all in on. But I mean, right now this is where we are. I mean, it's still very traditional to this stage.
Sorry, I want to step in here and say something. It's probably an opportune moment for almost a reconceptualization of intellectual property regimes. This question sort of extends much higher than beyond like just legal frameworks, because it's going to go to the heart of trade policy and overall economic competitiveness. We're really transitioning to a matter of intelligence. It's actually going to be driving innovation. There's obvious questions around about your ability to protect and actually enforce granted intellectual property. But a lot of the sort of, I would say, the creatorship in things of deep value is really going to like come through like artificial intelligence rails. Now, there's problems, significant problems with the existing IP frameworks, and there's never really been too much of an incentive to rethink through them, only with the exception when you have a very well-financed entity, and say I take Disney for example, and this sort of just demonstrates how the original intellectual property laws for patents, copyright, et cetera, were developed in the early 1600s in the UK. So it was actually the statute of monopolies, like adoption that sort of transpositional law effectively occurred in the early 1700s into the US. But, you know, Disney had to lobby the government because all their IP was was effectively expiring because it's life of the author plus 50 years. That's like a $200 billion company that just like writes down to like nothing at all. And so the US actually lobbied WIPO, which is the World Intellectual Property Organization, to actually extend that. But the broader based issue that you're going to have here is that it becomes very much a policy-based discussion in the way that intellectual property be granted in these things, and that's actually going to be really at the forefront of sort of economic growth from my perspective. And so territories that can think through this in a rather good way, and obviously there is like, you know, I mean, the PCT and all these other sort of, I'd say like international, supranational organizations and treaties that sort of harmonize and bring this all together. But, you know, like at the forefront of that is there is a much more pertinent question for government about what they want to do about it. And actually, the US and China have been sparring a little bit on opposing degrees of trade policy about co-inventorship for AI, for artificial intelligence in relation to patents. And so, you know, that's a giant economic lever that policymakers can pull. But yeah, I can go deep into this, but yeah.
But great feedback, Aaron. And maybe while I have you here, I think it would be great to know how does Molecule actually capitalize on the fact that a lot of the, for instance, the drug development, it's compartmentalized into different areas where you have maybe the inventor, the funder, the CROs, the different AI tools, where it's important to show who owns what, and in some cases you can have problems of royalties or IP. How does Molecule is able through the on-chain rails, through the IP NFT, able to capitalize and to solve some of these issues?
Yeah, thanks for that question, Rafa. So in respect of the conversation that we've been having all day around AI, we've been speaking about tooling. There is something at an infrastructure level that we examine within Molecule, which is really tooling for financial engagements or financial instrumentation. And it's probably an area that's not spoken about enough in respect of science. Like, we very much focus on advancing the science, but the science needs to push through relative market frameworks. It needs to go to stakeholders. You know, I reiterate the point before that, you know, just because it was done like 50 years ago doesn't really mean that we sort of need to adhere to what those standards are today, or at least not sort of, you know, start asking the questions about whether things can be done differently. You know, I mean, the on-chain provenance, the fractionalization, you know, great additive tools in respect to that. You know, but like with the, you know, the development of, and, you know, and actually, I mean, programmatic payments, you know, a significant move effectively in themselves, because, you know, agents can't have a bank account, they can't have a credit card or anything of the sort. And so, you know, and there's something nice about like code being law, and you know, knowing that you're going to have a natural enforcement of or adherence to like whatever's, you know, whatever is effectively being agreed. And I think you can start to see standardization in respect of like the way that a lot of these services effectively interact. But, you know, like a lot of that also bears in mind too, and I think Michael Torres, if he's here, was sort of saying this before, is that like, you know, a lot of these things do get bought by pharma. They're very mindful of like what is effectively occurring within the cap table and how things are recklessly capitalized, at what levels and things like that. And so, you know, like a lot of that can be created in like with the mindset that, you know, there'll be other industry participants that don't have such a, I would say, an adaptable mindset on the way that this evolves. But in summary, tokenization, so basically some of the fractionalization, you know, talking about like inventor attribution, you've got all the logs. I mean, algorithmically, you can run back who's made what contribution, tracing it back to the relevant patent claims or like delivery within services, et cetera. So like, in short, it's just having all the things there to actually develop the tools that are really, really needed.
And I think back to the programmatic funding, if I can ask a question to Martin now, because we've been discussing this constantly on Peptide. And yeah, what does that open up when an agent can use that? When can pay for its own when an agent can pay for its own experiments? When it can hire the lab on its own? Just what gets unlocked versus what gets risky? And how can agents start maybe participating as economic actors?
Yeah, so I think dovetailing to what Aaron was outlining there, I think the starting point for answering that is that this new, for me, the fundamental thing is that, as Aaron mentioned, in the AI biospace, you talk a lot about like how AI accelerates science. The jurisdictional compliance of those systems isn't really like the fun thing that people talk about. And so there's what I'd say, like what's really great about being in this collaborative experience is that we've been really talking about that from the beginning. So that's where like Molecules On-Chain Labs actually gives you a programmatic environment that can move at the pace of the AI in such a way that you have like this substrate where you can, use the traces that are being generated by the AI system and like basically publish those to the lab in such a way that you have this verified container of everything that was done that is, programmatically compatible. And so with that substrate, it's really like one of the things I'm most excited about is that it also solves for this question. Because what it means is that you basically can have an agentic system that can be tied to then a corporate entity, and you can even imbue the agentic system with an understanding of the regulation so that it could be like, I need more human input. Which is kind of, from a technologist perspective, kind of paradoxical, but that aside, I think what's really exciting here is that you actually have the primitives to create a truly mature entire package for this type of autonomous system where there are answers to those questions. And also just to mention, I think there's been, I think, some examples of how some earlier stage startups, if they get, they talk about all the AI they're using and so on, you might have some bigger players actually, challenge them in the courts so that they don't even get out of the science side. So here you have something that you can plug into from day one to have a programmatic audit trail. So yeah, I think that's like a key artifact that is now available to these systems that helps answer those questions of like, if you're gonna have programmatic funding, how do you do that in a compliant way and how do you show that you've thought through it? And that's what I think we're perfectly at the intersection of that, and it's really how, the on-chain component and the AI comes together then with also the funding in a way that actually stands up, essentially.
Back to Jose. Thank you, Martin. So Jose, in this decentralized infrastructure, how is liability and risk distributed when you have DAOs, tokens, autonomous agents doing science?
Well, liability is always centralized, right? So there's no such thing as like fully decentralization. When things go to court, basically what the judge will try to assess is who is the human in the loop that they can chase in order to ask for some sort of liability. So that happens in DAOs, that happens, any type of use of technology. There's like a sitting duck somewhere, somebody that kind of owns the trademark or, just made a post on X or something like that, that can be said, well, this guy actually has some sort of involvement because there's no full decentralization as we know. It's just how the court system works. They will chase somebody. It's impossible to sue everybody. They will sue, on civil claims, people try to sue as much people as they can, but it ends up being always the same guys controlling the protocol or controlling anything. So, of course, throughout the years, we're assisting as an increased decentralization of how these protocols work, how IP is being governed, how IP is also being registered, also on traditional ways. But one thing I wanted to add, and I think it's also important for people to understand what we're doing at Molecule, is that as it stands, and this is a sentiment that has been also from inception from Molecule, is that the current legal framework, the IP legal framework, is blocking innovation, is blocking scientific research. And the fact that the intersection with blockchain, with AI, allows that there is some sort of visibility, a much wider visibility of what has been achieved. It's also important that people can govern, people can actually claim the ownership of their discoveries, of their achievements, for everybody to use also in the future in a compliant and transparent way. And it's not the blockage system that we have been witnessing on the traditional legal framework on the protection of IP rights is more of the power of the community-driven management and governance of IP that I think matters more for breakthrough on discovery.
Maybe just a question to whomever wants to take it. Maybe a little bit controversial, maybe doesn't make much sense after what we've discussed, but does the law have to catch up to science? If we continuously iterate on these autonomous loops, maybe it gets a bit blurry who is the human that is in the loop or the group of humans after so many iterations and so many groups collaborating. Does the law catch up, or does agentic science run into some kind of gray zone? Who wants to take it? I'm curious.
I think just as a natural function, law runs as a reactive function. You can't prescriptively legislate for every interaction and everything that's effectively going to occur. And I'm talking outside of science. We've sort of also moved a little bit to a political landscape where grievance at any significant levels starts to determine what gets addressed at a legislative means. There's this sort of widening cliff between people who are determining policy or legislators and technology direction, and what that really fundamentally means is that anyone who has lawmaking power just struggles to understand tech in any meaningful way, and it's just going to be increasingly really, really hard for them to get ahead of anything that's going on. It's just going to be a question of what is necessary for a degree of political appeasement. So now I'll sort of switch to talking about economics. There's this overall imperative for almost every country in the world to be striving hard at innovation. It literally is an arms race. So, I think that there'll be this sort of mild undercurrent of entrepreneurs just being, proactively sort of pushed or supported to just innovate as hard and as fast as they can, despite the fact that the law is just sort of not there for them.
Let me just something. So, innovation comes always first, law comes after. That's how things work. That doesn't mean that judges, courts don't find a way to pick up what is happening and trying to subsume it in the existing frameworks, and that's an error. So that's basically what is the problem. Currently, the problem with AI tooling, collaborative DAOs, for instance. I've been struggling for the last decade probably to explain to a judge what a DAO is and how a DAO works. And for them, they just pick up on the existing frameworks and they call it a general partnership, or this is a kind of Einfachgesellschaft or something like that exists for decades already. And so there's not an appetite to understand on a futuristic vision how this could be a future new type of entity that lives on chain or whatever. Same will happen with AI, same will happen with other type of toolings. But that's how innovation comes through. It's pushing the boundaries, and then probably 20 years, 30 years, 50 years later, somebody will come up and say, oh, probably we need to change the law because this is not coping. My perspective is always the law is not an absolute blocker. Of course, we have compliance requirements, and of course, we have to navigate the legal system, but we always have to find our space, loopholes, perspectives of new interpretations, how the law works. I'm speaking now also about the new European AI Act on justification how you come to a certain decision based on AI tooling and so on. So we have already frameworks that allow us to push the boundaries a little bit forward. But to your question, of course, it's a gray zone. It will continue to be a gray zone, and it takes time to consolidate with different cases, with different discoveries, with different rulings, with different jurisprudence and studies that will be made on the applicability of these tools in practice to change the law in the future.
Yeah, makes sense. I want to open it up to the audience. Any questions that you want to, this is your time. Any questions where you have, yeah?
Where am I going? Where was the question? Ah.
Hi, thank you. So you talked quite a bit about like the evolution of like IP rules and regulations regarding like scientific discovery, especially accelerated by AI, and how we're like going through this period where there's this rapid acceleration of discovery due to AI that's perhaps only expected to compound, but perhaps there's this very slow regulatory process, and how then there's these new ways, decentralized technologies on the blockchain to maybe better coordinate, even the process of scientific discovery. I'm curious if, you've thought about or have any ideas about, well, particularly someone on the panel was mentioning, the liability problem of if you have like such a system, there's always perhaps looking for some person to be liable, such that perhaps that's also like a source of drag on the system. If you've thought about the potential for fully anonymous systems in which like that liability might be like effectively kind of obfuscated or made like not enforceable in some ways, and like maybe the future of steering these technologies more towards like using programmable cryptography for like encrypted data marketplaces where you might have like buyers and sellers able to say like, okay, I have like a proof of a peptide, that satisfies some constraint, and then I can like send you the information on chain in an encrypted way between two parties without revealing, either one. And if like such a system might have a competitive advantage against ones where there are like, let's say, liable entities at stake.
Yeah, I guess we've thought about a lot of things. There's a question of like how much time you have to like, go down these rabbit holes. I think the unfortunate matter of the way the world just works is we always just want to point at someone and just ensure that like they can be held accountable and fault can effectively be assigned. And the US runs very much a fault-based like litigation system. Like, you have a problem, it's always someone else's fault. A lawyer will tell you that. And, they'll engage you in legal proceedings. As, in respect to your question about like, autonomous, like encrypted marketplaces and, or, having organizations of the sort that just actually don't really identify the individuals behind it. This is where you probably sort of run into one of these conflicts where an entity that's an organization that's trying to assign fault to, something within the marketplace will just like work back up the, the chain of the protocol or the developer stack to find someone, that they're actually going to like pursue. I think this certainly is helpful as an exercise to think through and, hopefully have a series of technologies that are effectively deployed around it. The thing that I really struggle with a bit is, and you mentioned regulators, and now we're starting to talk about drug approval regulators as opposed to people that are effectively regulating AI technologies, is that, they've served a great purpose and they've sort of protected the public. What they do in essence is they take scientific data and clinical data, they assess it, and then they make an adjudication on marketing claims and effective market access. And, these are things that AI could prospectively do. right, as a thing, and then you don't have to run into, you know, all the sort of like political back channeling and things of the sort that that you need to get there. But you know, I think that you know, a lot of this is effectively going to evolve. I think some involves technologies, others involve people just sort of thinking through like whether there's a degree of jurisdictional competitiveness or, and you know, it's in the favor of countries to also come on side with this. We saw this in terms of crypto regulation, Bahamas, UAE, a variety of other places where, you know, they built significant industries and huge economic contributors because they came on, like they collaborated with industry to really understand what they needed and, you know, put some measures in place for these things to effectively advance. So, you know, I think it's iterative in that respect. And I think just, you know, like whether it's companies like Molecule or others just have to keep on sort of pushing the boundaries in that respect and also, and engage in open dialogue.
Awesome. Do we have any more questions? Cool. Thank you so, so much, guys. It was an amazing panel. And Rafa, you did the marathon sprint there. Well done. I think I'm the only person who's been on stage more than you have. Guys, I just need a minute. We're going to just quickly check something on the computer. And I also wanted to let you know that there is one more workshop that is happening. It was not on the schedule because someone messaged yesterday and they asked if they could please host. But it's about DAO governance. So if you're interested, we've got one more workshop. But we have, and then on the stage, we've got 2 more talks. And then that's it. We've wrapped up our 5th DeSci Berlin, which is pretty crazy if you ask me. And then, of course, rave, as I've said about 18 million times. It will kick off at 10, the music will start, and it will go into the early, early hours. Happy? Good. Okay, without further ado, we've got our second to last speaker, Migle, who's joining us from ETHSwarm, I believe. Actually, do you know what? Let me pop this back in here for you. There we are.
Thank you guys for having me. It's usually a different audience that I deliver the talks, but I thought that I wanted to bring the infrastructure layer and blend within the DeSci community. So hopefully the information that we will bring today, you should take this presentation as an invitation to collaborate and think about the data and the storage in a different perspective. And I wanted to speak about the potential bottleneck that is becoming more important for DeSci. So not only who is funding the science, owning the IPs, or coordinating the research, but who also gets to learn from the sensitive data. And I wanted to start the talk by why I was incredibly inspired to come to this community to share about decentralized storage and how it could potentially be the solution. I face this issue myself very personally. I have incredibly rare genetic disease, and patient 1 that was diagnosed was my sister, who is a legal Swedish citizen. And when she got diagnosed, I am Lithuanian citizen based legally in the Netherlands. My parents are still based in Lithuania. So all of a sudden, we had 3 different countries that needed to communicate because this genetic disease, vascular EDS, is so incredibly rare that in order to access testing, you need to provide a paper trail of work that you have a right to the test. And I had to learn a whole lot about it. And this was the process that took me around 2 years to get the right papers to get access to be tested. And unfortunately, the test was positive. And I spent 2 years just to get the result. And after I was tested positive, it took another year for the medical data to be transferred to Lithuania to my parents so that my parents can also get the proper testing. So it is odd that, you know, at some point the testing depended on the medical records from a close family member that was living abroad. And what stayed with me is that even when the data finally was moved, I could not clearly know who had the copy or who had an access to be stored it. Because I went through different, more private institutions, and then I tried the public health system, they all had different ways of trying to share the data. And it was shocking to me that I spent over a year trying to go through very official channels, and then when I went to a private clinic, they said just send over the documents over an email, and that will be more than enough. So when I realized that indeed my health data now was in many different sources of the data storage, I realized that I unintentionally lost access and understanding who will ever have this data. Would I move to Sweden and then all of a sudden realize that my health insurance is more expensive because Sweden also has access to my data? I still do not have that answer. And that's why I do think speaking about decentralized storage and how it could potentially solve this issue that I was facing could be the step forward. So to me, the question is simply not how do we open more data, but the better question is how can DeSci community create infrastructure where research can learn from the data without owning the data, and I would be, at the end of the day, in control of understanding who will be able to extract and have access to it. So to understand why this matters now, we need to look at where the DeSci and you guys have been progressing in the last years. I think this is my third DeSci, and it is incredibly to see that the funding rails that you have achieved and the IP ownership rails, the DAO coordination, super awesome that someone is giving another workshop close by. The vast exponential move in the AI agents and the execution and the discovery has been moving forward. See, but as agents become more capable, the bottleneck shifts, and it is no longer only about funding the research, coordinating the people, but where are the systems allowed to compute over? So especially when the data is sensitive, personal, or regulated. So this last layer that I'm trying to explain, the data and computational rights, it may become one of the biggest challenges in the infrastructure from the user perspective as well. So who is allowed to run the analysis, the models, the queries, the algorithms for the sensitive health data without necessarily owning it, downloading, or seeing the raw data? So in traditional health systems, the default was that hospital platform, then researcher, the insurer, or even AI company, they get the access to the data set, and then they compute over it and they extract the value. But in the vision that I'm here to discuss with you in more privacy-preserving health data variation model, the question becomes more political and more infrastructural as well of what technology we're using. So can useful computation happen when the data stays under the patient and community control? And is it even possible to do so on a very technical level? But before we talk about the computational rights, I want to slow down and talk about what owning the data truly also means. So when we say data ownership, we often imagine it who owns the data set, right? At the end of the day, when I was transferring my medical data from Sweden to the Netherlands, in theory, I own the data. It is my data. But the ownership can hide inside the infrastructure. So when we talk about the data, we should not only ask who has the legal claim. We should ask who controls the actual conditions of the use. Control appears wherever access, discovery, copying, computation is mediated. So there is where health data becomes the clearest example, because the health data, the tension is not abstract, right? It is not theoretical fight between openness or privacy. Both sides, they face the legitimate issue, and I do think that researchers really do need way easier access to the health data, but the patients, they really do need protection from extraction. This is why the health data in this very case, the tension between the user and extractor becomes so important. So indeed, this just showcases that I today do not have any control or knowledge who has the cached copies of my medical data, who has the access paths. If one person that is on their work email, lingering the email in a backend, if they leave the company, would all of that data information would be wiped. Again, I don't have the trail of it. I don't have technical or even theoretical way of understanding it. So since the health data makes this tension impossible to ignore, because both sides need the access, I just kind of wanted to look at the researchers that has the real needs, and that's most of you, right? You need the longitudinal records, cohort analysis, and then AI training signals, the public health statistics. But then as an individual, we also want the privacy, the consent, we want the revocation rights, and also the contextual integrity. As I said again, just sheerly understanding whether my records will be shared. And also protection from extraction. So this is why health data is such a strong example, specifically when it comes to decentralized storage. And the problem is not that either the researchers or the patients are wrong. I think both needs are very valid at the same time. So that means that not only access is the problem, it is also the computational problem. The health data is not a commodity, and within the EU regulation it is pretty clear on that. So one current answer to this problem is the idea of personal health data spaces that you see. So we had a Caltech, a Tallinn Technical University, and one of their professors, Thomas, conduct a very on the surface research on his attempt to educate his colleagues as well. And it points toward the familiar DeSci ambition of patient-owned health data, spaces, decentralized content address storage, research reuse, solid-style pods, and AI or public health applications. So this is a useful direction because it moves away from the idea of the health data should live only inside one hospital and one centralized platform or institutional database. But I think it is very important in the context of the limitation framing here as well. Because I truly do not want this talk to come across that I am just pitching to decentralize the storage and the health data, because I also don't think that's a solid solution. So it can treat the health data, the PHDS, it can treat the health data as if it were one stable file or one unified record that only needs to be placed into decentralized storage. But the health data is not one file, right? The health data is a living space, and it tells the history about me and my family. It changes over time, and then new records are added. In my specific case, my genetic disorder has around average living age of 28. I have surpassed that, so did my sister. However, there is a vast difference in the conditions and the symptoms that me and my sister are experiencing it. And we're constantly updating our healthcare data to hopefully in the future also share with the researchers why in one genetic tree we have such a differentiating symptoms. So consent changes and the health records are constantly updated. And this is where I would like to introduce a little bit more this swarm architecture, the technical architecture, and a serious decentralized swarm as a technical solution implementation would not rely only on content addressable storage. So content addressing is powerful because it let us say that this exact file is this exact file. And if the file changes, the reference who changed it also changes. So this is very useful for integrity, citations, and verification, right? Whether I was the one that made the change to my health records, was it my doctor in the Netherlands, or was it a third-party doctor if I had an emergency today in Berlin and that doctor needed to change my health records as well. So since we established that the health data is not only a fixed file, the health data changes over the time and the records needs to be added. So we need a way to say who is allowed to publish if the data is the valid one. And this is where the COCs matter as well. And COC means single owner chunk. So that's something that comes from the Swarm technical infrastructure. And in simple terms, it is a Swarm's primitive to tie an update to a specific owner instead of only asking what is the content, we can also ask who assigned this update. And then when those chunks are used together with feats, they can support changing reference over time, like saying, this is the latest valid version published by this owner and validated by this owner. So for health data spaces, that matters a lot because the goal is not to just store the medical records once, the goal is to support the living owner control data space where updates can happen over the time. But since the PHDS it's not a bad idea, the critique is that it should not be imagined as a static data locker. It should be imagined as changing governed owner controlled data space. But when we look at the proposed architecture from more closely, we can also easily see decentralization can start behaving like the data bank. And this is where I, again, give the disclaimer of understanding that I'm not proposing only to decentralize the data, but understanding how we can even turn decentralized data eventually being centralized back. So on the surface, the architecture of decentralization is our healthcare service providers, decentralized storage network, they're all communicating, but decentralization at the storage layer does not automatically mean decentralization of power. And as I said, because it includes indexing, package, selling access to it, reusing the secondary research. So the question is not only if and is the data stored decentrally, but who controls the access paths. And the three assumptions that DeSci could challenge that I see is the first assumption is that fair automatically means ethical, right? Findable, accessible, interable, or reusable sounds good for science, but when the source of the data is person's body, fair has to be opt-in and not assumed. The second assumption is that encryption carries governance by itself. And encryption is important, but it does not decide who should access, under what purpose, for how long, and with what accountability. And the third assumption is that decentralization erases the power. The power can be moved to the keys, to the access of the paths and the cached, and the computation. So health data is not an ordinary data, and it is reusable only under strict conditions. So that means encryption helps, but it does not make governance disappear. The key issue is purpose, permission, and reidentification risk. This is the main conceptual shift. The research pattern is give me the data set, but if it moves into the central repository and then a researcher, institution, or AI model works on it, it's a different one. So that familiar model, but it creates a very strong power transfer. So once the raw data set moves, the person often loses meaningful control. So the better pattern is different. Instead of giving someone a data set, we define what they're allowed to do with it. What method is approved for what purpose, and under what permission, and under what result is allowed to be leaving. So the data access becomes computational rights, the raw data becomes verifiable outputs, the ownership becomes accountable use, and extraction becomes constrained learning. So this is my thesis that I leave to you as an invitation to come and join me in this research and a path that I say to bring the code to the data. So this is the analysis at the edge. Very simply, the data does not leave its protected space. The method travels to the data. The method has to be explicit and constrained, and only permitted result leaves. But it is important not to over-romanticize this proposal. And analysis was not invented mainly for privacy in IT, but it is often used because the data load is also so high and incredibly difficult to process it. So whether the data is a simple example, weather data, right? So that's how it's currently set up, that the sensors generate huge amounts of raw measurement data, and then it would be inefficient to send every raw measure of this data into the cloud. So before doing anything useful with it, some analysis happens locally. So trying to wrap it up, right, just a moment. So this is the research corruption that we are proposing, and the output and the schema. Knowledge shared without the extraction. And these are the primitives where I want to kind of showcase where you can come into the Swarm universe and try to understand how it could be useful for your own project. Swarm should not be persisted as the solution, as I said, but more as the primitives that we've sent for accountable research objects. A research object is not only a paper, the manuscripts, the access rules, the citations. And this matters because science is not only about producing the result, it's also how we do that. So this is the idea from the protected source to computation and to travel the queries through the different pods. But protected computation over sensitive health data is not something we should pretend that it's already solved end to end. And in this model, data remains under the user or data space control. The algorithms become inacceptable, but access does not collapse into the central key holder. So this is why the idea of traveling aggregation or traveling accumulator matters. And this is the prototype that I propose that is worth testing and look into it. And I really would love us to learn from the data without taking the data. I will cut this a bit short, but if anything what I just said made any sense to you, I specifically did not put the link, the QR code to the websites of Ethereum Swarm. I put it directly to our Telegram. And if there is a demand and interest, we're more than happy to host a workshop from very technical to a non-technical perspective for you to learn about all of what I said and much more in depth. So if there is demand, we're more than happy to organize and meet you folks online or in person, because we do truly believe that there is a way of accessing the data without owning it. Okay, I will make sure that I personally give you guys the invite. Sorry, it was working earlier today, but I will give you the QR code if you come to me. Thank you.
Amazing. Thank you so, so much. I always think it's a good sign if someone tells you that your QR code isn't working, then you at least know that someone's scanning it. Okay, guys, we have one more talk, and then we will conclude the 5th annual DeSci Berlin. It has been so amazing to host you. The whole event was live streamed, so if there are any talks that you want to come back and look at, you're more than welcome to do that. And you can also reply to any of the Luma blasts, and it'll come into my inbox. So if there's anything you'd like to follow up more, any intros you'd like made, some topic you'd like to pick up, just email me, and I'm super happy to help. One other thing, there is a lost ring and a lost set of keys. If they are yours, please just come find me and I can help you get your stuff. Is it okay? Okay. Okay, guys. Thank you so, so much. Alex, take it away.
Cool. Hello, everyone, again. Yeah, so this talk is representing BeakerDAO, which is the second organization that I'm associated with. So to give you guys a little bit of context here, I've been in venture capital for 4 years, and I was one of the early backers of DeSci through the fund that I worked at. We invested in Molecule and in Bio as well, and in VitaDAO. That's how I first got involved. And currently, I'm working with an organization called BeakerDAO, which is, I think, the only institutional investor fully focused on DeSci. So this talk, I want to share a little bit of our perspective in how we're thinking about underwriting DeSci currently, given everything that was presented today and yesterday. Cool. So I want to start by actually giving you guys an example of something that happened, a couple months ago, where like an AI agent, an autonomous agent, was basically investigating a drug candidate for a target with no approved treatment yet. Basically shared some of the findings or some of the questions and the thought process on X. And we had actually very prominent industry figures publicly discussing these developments, fully live, fully open. The agent then ingested some of that feedback, basically, iterated over it and developed and settled all of that conversation into like an IP NFT on chain. So this loop is something that Web2 just cannot deliver. And this is one of the superpowers of Web3. We can build all of these things in the open, and we can actually grant ownership for people that participate in that process. There's a chart missing there, but anyway, essentially what I think AI enabled for drug discovery overall is that invention got a lot cheaper. Like the ideation process got a lot cheaper. Basically, AI compressed the top of the funnel by 30 to 70%, depending on which measure you take. But essentially, it still cannot touch or still didn't have a major impact yet on things like ownership, things like capital formation, wet lab throughput, and regulatory acceptance. So these are the four areas where I think DeSci really comes in, and the areas where we're actively looking at in terms of capital allocation. The first thing really is ownership. So this is one of the superpowers of blockchain. From day one, it was one of the core things that it enabled. It enables you to own your tokens, enable you to own your data, all of that. So yesterday we had a presentation for Kevin where he presented the Molecule Lab, where essentially ultimately you can have like in your C6551 like a token bound account where an AI agent can hold all of its information through this vault. And the agent actually has full ownership over that, which is pretty unique. Obviously, we have the Bio Launchpad as kind of like the main capital formation vehicle. So this is basically where these AI agents can come and present their ideas and raise capital for it in the open with the public. And we recently had Adaptive Bio on stage as well, Julian, talking about how they are running some of these experiments with Peptide. And Peptide as an AI agent can only pay through blockchain rails, doesn't have a bank account. So the wet lab invalidation through 402. 402, for those of you who don't know, is an HTTP native payment rail. Again, fully on chain. So this is only possible with blockchains. Cool. So given that that rail exists, how are we thinking about deploying capital, right? The way we see it, there is like two races going on in parallel. One is the race to invent and build the best model. So this is where I think the traditional AI space, so to speak, is making loads of investments in. In our opinion, it's very crowded, very capital intensive. Sorry. And margins are commoditized essentially. The second race is the race we were focused on. Is basically the race to hold the tide of the output. It's where I think most of the scarcity is, and where the value accrues the most. One thing to note, though, obviously, the faster the race one goes, the bigger the prize and the bigger the output for race 2 as well. So I want to show you guys two examples of something that is already happening, already live. One is Peptide. You guys heard from Rafa extensively today. Basically, they have this closed-loop peptide pipeline running with a bunch of AI agents, tested a bunch of different peptides with wet labs integrations through 402. And the other result, right, which is the one that I'm currently involved with through VitaDAO, where essentially we have like a big data mode in that Aubrey was firstly trained over LAVF's unpublished lab notes. So you guys probably heard from Aubrey yesterday. He's Aubrey de Grey. He's the scientist that inspired us to build Aubrey. So essentially, VitaDAO was built on that, plus all of the academic research that is publicly available, plus all of the data that comes from the projects that VitaDAO funds. So VitaDAO, as I said in my last call, has funded over 30 projects, deployed over 4.5 million, and all of these projects are generating loads of data, and we're basically leveraging that data to further train and refine Aubrey. Cool. So how we're thinking about building a portfolio of assets, given everything that we're talking about here. The way we see it is really kind of like a barbell play, where we have high beta DeSci on one side, and this is things like Bio, things like Research Hub, where Bio is basically like indexing the whole sector. It basically has an ownership over every token that launched through the Launchpad. And we have the long tail of assets, meaning the AI agents themselves, like Albright Peptide, but also the individual IP tokens, right? Like VitaFast, VitaRNA, you guys heard from Michael before. So VitaRNA is like an IP token. It is backed by the IP that is generated with the R10 Bio project. VitaFast, the same thing. We're accelerating it right now. We're going to talk about jurisdiction arbitrage in a little bit. So the way we're thinking about this portfolio is, these two different edges. And in the middle, we underweighted deliberately, and we have some DAO tokens still, like VitaDAO and HeriDAO. I think they're making quite a lot of progress in some areas as well. But that's how we think about the book. Like beta funds the weight, and then the tail pays off for being early. And we are actively involved in some of these IPTs and in AI agents projects, so we can accelerate them further. Right. So one of the things that we spend quite a lot of time thinking about as an institutional investor and a serious capital allocator is actually what makes all of this underwritable. Because I think previously in crypto we had like a major issue of buying tokens that actually don't give you much. So I think now you guys heard from Ben early on. One of the things that I think unlock a lot of value for investors is really the client company model, which allows you to own tokens and equity in parallel. It actually gives you rights as an equity holder over the financial upside of that project. So if that IP ever goes to the market, if there's ever a drug created from that IP, if there's ever royalties created from that IP, that the proceeds of those sales will flow to an entity, and as an investor, if I hold a token, I can actually qualify to have equity in that entity as well. So I think this is one of the main unblockers that we have currently, and it's very, very important from an institution perspective to have this working smoothly. So very, very keen to see the first projects implementing Conch Company in real life. And if you guys remember the 4 items that I outlined before, the fourth one that we haven't talked about yet is really the regulatory landscape. So I think, obviously bringing a drug to market is a very tedious and long process and very expensive process. One of the main reasons for that is, how strict regulation is for some of these things. And I think one of the superpowers of decentralized networks is that it actually is globally distributed, right? And what that enables essentially is for you to tap into jurisdictions that are perhaps more open to running a trial with like a little bit of like lower thresholds. Still safe, obviously, but I think this is one of the superpowers of DeSci really, and it's one of the things that we're leveraging with VitaFast, for instance, where we've been in talks with the regulators in the UAE, and they're pretty keen to first of all back longevity, which not all jurisdictions are, but also to run trials in a much faster and cheaper way that you would do in any other jurisdiction. There's other examples of that. I think HeriDAO is doing something in India as well. So anyway, this allows us to basically bring these drugs to market a lot faster and a lot cheaper, which I think is one of the core unblockers of DeSci as well. So yeah, all in all, I think DeSci is running this different race where we have AI agents and massive acceleration of these research projects. And as institutional investors, we are keen to support founders and projects willing to work on with us on that. We're basically positioning ourselves at the settlement layer for autonomous biology. That's how we're thinking about it. Thank you, everyone.
Thank you so much, everyone. That is the end. Get home safe. I love you all.
you.